Uh, I welcome all to Chambers. It's wonderful to see a huge turnout, whatever the case. We appreciate you being here. With that, I will ask Noel to call the roll.
Tim Slocum.
Here.
Don Walsh.
Here.
David Borwick.
Present.
Peter Talbot.
Here.
Jim Sink.
Here.
Sandy Pavano.
Here.
John Mylone.
Here.
Sylvia Nichols.
Here.
And David Belver.
Here.
Thank you. Please rise for the pledge. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I'm going to start off with an explanation of public hearing procedure and agenda, just because I think it makes it simple to get it over with from the start. We have two public hearings tonight. Staff will make one presentation for both, beginning with the first. So in other words, we're not going to repeat the same presentation twice. As chairman of the council, all questions go through the chair and will be directed by me to staff. All comments will be directed to the chair. My colleagues on the council will be listening to your questions and comments, but cannot participate in discussion. Both public hearings will welcome questions and comments from the public. A speaker's time is limited to 3 minutes. There's to be no applause for any speaker, please. Thank you in advance for your attendance and patience and contributions to tonight's public hearings. I'm going to start with just an opening statement, and then we'll go into the official agenda, so to speak. The town council is obligated to investigate opportunities of any kind that will be in the town's best interest. In the case of the health district, we have an opportunity to join South Central Health District, maintain an office and town hall for the convenience of our residents and business users, and provide a higher level of service at a lower cost. COVID was an all-hands-on-deck scenario, and Cheshire rose to this great challenge, along with many town partners, including our schools and teaching staffs and all other town departments. We did it all, and everyone involved deserves equal credit. Tonight's public hearing will address your questions and concern. And with that, I'm going to go to the first public hearing, which is the town of Cheshire's withdrawal from the Cheshire Health District. Noel, will you read the call?
The town council of the town of Cheshire will hold a public hearing at 7 p.m. on Tuesday, October 10th, 2023, in the town hall council chambers, 84 South Main Street, Cheshire, Connecticut, to consider the town of Cheshire's withdrawal from the Cheshire Health District effective June 30th, 2024. Electors and citizens will be heard at the public hearing concerning this matter, dated at Cheshire, Connecticut, the 28th day of September.
Thank you for that. We now start the agenda. We've called the roll. I've explained our procedure and agenda beforehand, so I won't do that again. We've read the legal notice. We will now take a presentation on the hearing subject from town staff. Our town manager, Sean Kimball, will be presenting a PowerPoint presentation.
All right, just bear with me for 1 minute. We're going to drop the screen and put a PowerPoint up for just a brief presentation.
Just for the record, I'm still here. And we can see what you're being presented as well. It's a dual screen. It's pretty fancy stuff. We got it in the town's waste bulky pickup.
Can't see anything.
give that just a second to warm up. And first of all, I want to just thank everybody, as Chairman Slocum said, thank everybody for coming out tonight. I know on a variety of topics, but again, it's just wonderful to see such civic engagement here. And we appreciate it. It's part of what makes Cheshire so great. So I'm Sean Kimball, I'm town manager, and I will be doing a brief presentation here on the primary reasons behind consideration of this health district transition, and also a few, I guess, responses, if you will, to some questions that have been posed and communicated through our comments, email, and through our council members. So I will start now. Here we go. Is that going? There we go. All right, I'll just start with a brief recent history. All municipalities in Connecticut are required to have a health department or to be a member of a regional health district. Chesprocott was formed in 1976 as a regional district for Cheshire, Prospect, and Wolcott. Pre-pandemic, I think it's fair to say the focus was primarily on environmental permitting, restaurant, business licensure, and inspections, along with health, education, and emergency preparedness. The pandemic certainly elevated the visibility and highlighted the critical importance of an effective public health emergency response. Cheshire's local response was a collaborative effort with many town stakeholders, including Chesprocott staff and their board of directors, the MRC volunteers, many of which I know are here this evening, Cheshire Police, Fire, and EMS, Cheshire Human Services, Cheshire Public Works, and the Cheshire Public Schools. But over the past couple of years, concerns have been raised by the Cheshire Town Council and were shared with a meeting called for by Chairman Slocum last November with the Chesprocott Board, along with the Wolcott and Prospect mayors. Some of the items that were raised were significant per capita membership dues that have increased in the fiscal 22 budget. Those increased by 28%, about $84,000. Some complaints that were relayed from residents and businesses in 2022. Questions about plans for the over $1 million reserve fund balance that exists with Chesprocott now. Justification and unknown costs for the towns with respect to plans to construct a 4,000 to 5,000 square foot headquarters building. High staff turnover and acknowledged employee morale issues, and increased permit and plan review fees out of line with comparable districts. So some of the factors that I'll be kind of outlining here for our consideration of joining the South Central Health District include, maybe first and foremost, their familiarity with the town of Cheshire. I think it's important for everyone to know that the South Central Health District's executive director is a former Chesprocott deputy director. She was there for 6.5 years. 5 of South Central's staff previously worked for Chesprocott. So again, there's a lot of familiarity locally with South Central for Cheshire. 4 were with Chesprocott during the very first few years of the COVID-19 pandemic and worked alongside, side by side with town staff and the MRC volunteers to manage our vaccine clinics. And frankly, at this point, there's more experience with Cheshire's pandemic response in those early years now at South Central than with the staff currently at Chesprocott due to so many resignations and turnover. The factors and another factor in support is the board governance that promotes municipal involvement. South Central board members include the first selectman of Middlefield, along with the town managers of both Southington and Plainville. The chief elected and executive officials of Prospect, Wolcott, and Cheshire have never served previously on the Chesprocott board until I joined the board about 2 years ago, a little less than 2 years ago. And Chesprocott's board chair and the health director actively resisted having a municipal official on the board, despite being commonplace and welcomed in nearly every other health district in Connecticut. Another factor is improved convenience for residences and businesses. South Central has proposed staffing a full-time annex here at Cheshire Town Hall. This would provide a one-stop permitting of sorts location for residents, businesses, and contractors coming to use our building office, our building official's office, and again, being in the same building for permitting with respect to Chesprocott, with respect to the health district. Improved communications and coordination with other town departments available here in Town Hall. And the plan to transition the South Central Health District is fully supported by all town management staff and department heads for the town. Additionally, reduced town budgetary cost. Chesprocott's current year per capita rate charged to member municipalities is among the highest in the state at $13.15 per capita, which for the same year this year, South Central's is currently $6.65. Through our discussions with South Central, we're expecting their per capita will be $8.75 for the upcoming fiscal 25 year. And again, when you compare that to the 13.15 currently with Chesprocott, assuming that stays flat, the town of Cheshire would anticipate a budgetary savings of about $126,000. This avoids also the potential requirement to share in any construction costs for new Chesprocott headquarters. And additionally, significantly lower permitting and plan review fees. So nearly all fees for permitting, testing, and reviews will be lower, often by 50% or more at South Central when compared with the current Chesprocott fees. I've included a few examples you can see there: soil testing, septic permits, well permits, child care center plan reviews, class 3 food service fees across the board are lower, in addition to nearly all the fees charged by both districts. Now I'm just going to turn it to Assistant Town Manager Arnett Talbot for just a few slides on continuity of Cheshire's social service programs.
In order to allay some concerns that we've heard regarding some of the programs that Chesprocott offers in town, and speaking for the Human Services Department, our Human Services Department offers many long-standing community health programs which were well-established and successful prior to Chesprocott's request to partner, including the town does mental health first aid, substance abuse prevention, QPR training. As a matter of fact, several of our staff are certified to train people, suicide prevention programs, Narcan training programs, strong collaboration with the Cheshire Public Schools for student care, mental health, and also individually servicing and addressing issues such as hoarding, homelessness, food insecurity, crisis intervention, mental health, and other issues that impact public health. The Cheshire Human Services will continue to administer these critical services and these programs, and will continue to pursue the grant funding to support these efforts. We've been very fortunate to achieve a significant amount of grant funding to minimize the cost on our budgets. These services and programs will be enhanced by the experienced and professional staff of South Central, and collaboration and planning has already been done. Communication has already started in preparation. As an example, South Central secured and administers a substantial drug-free community grant, which puts them in a position to provide more extensive drug abuse awareness and for prevention programming than is currently available through Chesprocott. And South Central has developed a significant community partnership and will embrace and foster the partnerships that we've built within this community among the public health and town staff, and will be able to provide a deeper and broader base of support and services for our residents.
All right, thank you. And just a couple more slides. I want to address, I think, some common misconceptions with respect to the MRC program that Chesprocott has run through, and I think became most visible during the pandemic. Our local MRC volunteers continue to have the same opportunity to serve for their community, and would play a critical role at South Central. South Central is fortunate to be part of a broader Capital Region MRC, which serves 41 towns and has far-reaching capacities and resources. There's a website there if anyone wants to read up on their efforts. They do multiple monthly trainings, provide a lot of resources and opportunities for folks to continue, because again, I saw firsthand, I've been in this role for about 6 years. I was here for every minute of the onset of the pandemic, and our efforts, which I stand behind full stop at the Cheshire Community Pool in partnership with Chesprocott. And I can tell you that the MRC volunteers are a critical component of any health district's success, and they would be so at South Central as well. So I just want to make sure everyone understands, and I understand and appreciate everyone's passion for the time and the really shared sacrifice and shared experience that we all had here in Cheshire. And I just want you to know that that would be, and our expectation is 100% that would be continued with a transition to another health district. I mentioned extensive trainings, programming, volunteering, and member recruitment opportunities available within the member towns that SCHD serves. And again, uses the same CT Responds platform that I know we've all used for notifications and for enrolling in the MRC program going forward. And finally, the Capital Region MRC supports South Central and has encouraged the district's growth by endorsing any opportunity for the addition of member towns, regardless of region. All towns and MRC volunteers are welcomed and encouraged to continue to serve. And finally, since 2003, the Capital Region MRC has served the greater Hartford region in blue skies times during emergencies. The COVID-19 pandemic transformed the unit from 250 members to an unprecedented roster of 1,800 members who contributed more than 20,000 hours of service. So that'll conclude, again, the presentation. Let me just get the screen back up before we carry on with the hearing. Thank you. Just don't want to.
Thank you, Sean and Arnett, for your presentation. Before we go on to the rest of the agenda, which includes questions and comments, I would like to read into the record an email received by Susan Lonchek. She is the director currently of the Southington District and the former staffer that served in Cheshire for 6.5 years prior to her exit. It begins, "Good evening. Sean, I appreciate this email being sent out to members of the council. I have remained quiet and dedicated to my district while this transitional choice for Cheshire has been forging ahead. I must admit, I'm beyond disheartened to see the misinformation and lack of truth in so many details being disseminated to members of the community and the council regarding South Central Health District. Attached, please find my response to the most recent comparison of CHD and SCHD sent to many individuals that I personally worked with during the pandemic. Although I am choosing to remain focused on the amazing work my district is doing, I'd like to provide some clarification regarding the differences in pandemic response. This difference between districts seemed to be one of the most prevalent concerns. In a public health emergency, like all emergencies, there's an all-hands-on-deck response to what happens. No one district or department in the state handled the pandemic the same way. That does not mean communities weren't served. If the general public learned anything about the public health I would imagine they learned that most of our work is done behind the scenes and typically goes without notice. It also gets accomplished differently with the same outcome to protect the community. I was working at CHD during this time, and I believe the work we did was amazing and served our community well. I can share that SCHD served their communities well too, through partnerships with Hartford Healthcare and Griffin. They provided vaccination clinics within their communities and to the boards of ed, first responders, and town employees alike. SCHD was also an active partner facilitating the mass vaccination clinic effort at the Oakdale Theater in Wallingford. At the same time, the Cheshire Health District was vaccinating at the pool in Cheshire, utilizing resources, MRC volunteers, and partnerships with larger entities assisted SCHD best at that time with the same outcome for the community. As we near the hearings, I must respond and protect the efforts and integrity of the district I so proudly represent. I appreciate your time and attention to this. And I did ask Susan's permission to read this into the record. I thought it was a cogent, concise, and very clear statement, and also expressed her dignity and willingness to serve in the next district for us. So with that, I am now going to open the floor, following the same rules I expressed earlier, if you will, to questions. And the best way to get a question answered is to come to the podium and to give your name and your address and then ask the question. That's all for the record. So if anyone would like to ask a question, feel free to join the queue and come to the podium. If I may, I'd like to go with questions first. I think it's a little bit cleaner that way.
I have a statement with some questions in it.
If I may, I think that's appropriate, but could you make the statement with the comments? Well, you're first in line.
Yeah. So how about if I start and you can tell me to stop?
Well, there's only the 3-minute rule.
know,
But
I know.
we'll
Okay.
certainly welcome
Okay.
anything you have to say, Maura,
That's
and
okay.
we appreciate your being
Yes.
here.
Okay. So Maura Esposito, 30 Holly Road. So firstly, I'm not as the Cheshire Health Director. I'm a town resident of 27 years. Both kids went through through the Cheshire Public Schools. Served on the Cheshire Town Water Pollution Control for 10 years. Very instrumental watching Mr. Malone and his what areas should be sewered and not were part of the projects that I did during that time. But I'm here today as the Director of Health. Been at Chesapeake Health District for 9.5 years and 2 years in Killingworth. I've been a registered sanitarian for 30 years. I've done a lot of soil testing. I know a lot of this environmental background. I was a sanitarian with Chesapeake for over 9 years, 7 of that paid, 2-year volunteer. I've done a lot of accomplishments under my role. In 2016, to help realtors and contractors, we scanned all the street files. Realtors and contractors still love being able to go in and when they look for an as-built, they can find an as-built. We've had 2 community health needs assessments. These are very vital to find out what the needs of the communities are. Unfortunately, those needs still haven't changed. It's still mental health, substance abuse, good nutrition, good exercise, and oral health. I've done a community health plan initiative. We currently have 3 UConn MPH students, and we contracted with a Southern MPH student to do a strategic plan to give us a better direction of where we need to head. Yes, during the pandemic, no one expected a pandemic, 18,000 vaccinations and 200 clinics. I couldn't have done that without the MRC. I was not allowed by DPH to be a recognized MRC. But on 2020, we were known as the Cheshire Citizens to React to Disasters. We were our own volunteer company that were actively drilling. In 2020, in September, the Department of Public Health finally gave me that recognition as an MRC. And I want to thank everybody here that is an MRC in this room for all your dedication, because without it, we could not have done and been so successful in this community. I've gotten us a volunteer donated community health mobile van from partnerships with the community Trinity of New England. And I've taken a near bankrupt health department to a very financial stable health district with excellent yearly audits. I would love to have been able to comment to all those comments, but unfortunately I was not privy to that. So I would love to have a deeper conversation about the presentation. But I do have a robust environmental health division with a chief of over 30 years of experience and a fully staffed with 3 sanitarians. Our community health in 1975, this town council voted to join the health district. In the proposal that was proposed to you, it was to provide immunizations, clinics, and response to infectious diseases. In 2013, the public health nurse was let go, not while I was there. In 2014, I started bringing nursing services back to this community. We started with 1 flu vaccination, the next year 2, and just this past week, we'll be doing 250 at Elam Park. We did 50 at your senior center, and we'll be doing 150 at your Cheshire Public Schools. Our full-time health educator and our full-time public health nurse do these clinical services of both flu and COVID, A1C, blood pressure, and respond to the many communicable diseases. This past year, Cheshire alone had 250 communicable diseases. These include things from Legionella diseases, deaths, to elevated lead blood poisoning in young children in our community. We just finished our health educator just finished 2 2 year-long diabetes prevention program, one at your senior center and one at the Y. And in the spring, we'll be back at the senior center doing a Matter of Balance, which is an elderly fall prevention program. We're co-leaders of the Cheshire Healthy Communities Coalition. And in that capacity, we provide community speakers, workshops, and many trainings. Mr. Slocum did come and meet with our board and our town managers, our town mayors, both Mayor Bob and Mayor Dunn. I'm not going to deny that. He expressed concerns over our finances, building a new building, and contractor complaints. Our per capita has not raised in 3 years. It was raised due to the pandemic and unknowns. Inside that book, Aaron, I did bring a lineup of this past week. The State Department of Public Health did provide everybody with updated per capita costs. And I felt that I needed to share this for sister health departments that do the same population. Could you pass that out for me? Same demographics and same services. And you will see that our per capita, are all within there. Or give it to the chairman to see if he can pass it out, Aaron.
Oh, that's fine.
Our board has indicated that they would be open to revisiting the per capita. This is in our April 22 minutes. Fiscal year 24 budget process was robust with many recommendations to reduce costs. Had Chesprocott Health District Board known of Cheshire's intention, I'm sure they would have met to address their concerns. I believe I've provided the residents of Cheshire the best public health services and have always strived to find alternative funding sources so not to put additional financial burden on the towns while maintaining excellent services in our environmental, emergency preparedness, and community health programs. As a public health professional, not all health departments are equal. I hope that the town council members can table this vote so a deeper conversation with Chesprocott board members can offer a counter proposal. A 47-year relationship is valuable. Thank you.
Thank you, Maura. Hello.
Hi, my name is Frances Storm. I live at 150 Cook Hill Road, Elam Park. The first thought that I had was I heard the presentation that was made, and I noticed during the presentation that a lot of mention was made that a lot of former Chesprocott health people were now with the SC, whatever, okay? And I thought to myself, well, Chesprocott couldn't have been that bad if they're bragging about having a lot of their people that left them. I don't know why they left them. That's a whole other issue. The other thing is I was very upset that Chesprocott did not have a chance to make a counter presentation. Fortunately, this lady has tried to do some of that now, but not knowing the questions that were going to be raised about them or the statements that were going to be made, she really couldn't address all of them. I have been not making applications, not had inspections. I've just been there when I needed COVID masks, when I needed COVID test kits, and they've always been there for me. The fact that their costs are so much higher, I ask this question because I don't understand. You're talking about the other health district having an office at the town hall. Chesprocott didn't. They had to pay rent for their location. Maybe their cost would have been cheaper if they had had the ability to have an office here at the town hall. I really don't know all of the factors. That's it. I'm finished. Thank you.
Very much.
Good evening, Mr. Slocum.
Hello.
Town Council. My name is Michelle Mado, 128 Pleasant Drive. I am a registered nurse. I am a nurse educator, and I am a member of the Medical Reserve Corps. I'm coming before you tonight in reference to the seemingly rushed decision to change health districts. I have some questions as to how this came to be a thought for the Town Council. I reviewed the agendas of the 2 to 3 most recent town council meetings, as well as the Chesprocott Board of Directors meetings, and found no mention. However, you did mention, Mr. Kimball mentioned in his presentation that in November of 2022, there were some conversations about that, and especially in reference to the complaints. So that led me to have more questions as to what were those complaints and how were those complaints handled and resolved. Other questions I brought with me.
You want
Was
that one
there-
answered first?
Oh, you'll answer them in time? Oh, okay, yeah. Well, that ate into my 3 minutes. I got a lot of lists.
Your long list will have to be reduced then. But just to answer that question, our town manager does serve on the board. And we have had reports from the town manager. That specific meeting, all those questions were raised, and there was absolutely no response, no effective response.
Okay.
It just was not forthcoming.
Was there a public health needs assessment done for Cheshire? And was Chesprocott found lacking in any way? And if so, was Chesprocott approached about filling that need?
Well, we have an obligation to meet the public needs, and we can do so, and I believe will. We did not do a compare and contrast other than going and seeking other departments that could perhaps serve us better at lower costs. There are fiscal considerations here.
Of course. Was there a gap analysis done in
That-
reference
That's
to the
above my
services?
pay grade. You'd have to explain gap to me, and I'm not going to take the explanation now. Thank you.
What support has the town offered Chesprocott to make the public health and safety needs of this town to ensure that they've been met?
Well, we
For
get,
example, let me offer an example.
okay.
The proposal to join the South Central Health District mentions one-stop shopping at Town Hall. Has that offer been made to Chesprocott to offer office space, a location, office equipment here at Town Hall? the same?
As explained by the presentation that came before us tonight, and by Moore herself, I believe Moore mentioned this, there was designs on a fairly substantial new headquarters building on a piece of land that was donated, obtained through a request of the state, and the land wouldn't have to be paid for. But we had grave concerns about paying a mortgage, which would fall onto the ratepayers. Every member of town is counted. It's a head tax in a way, and we're all paying for this service. And it's an important service, no doubt, but its effective delivery is very important, and how they spend their money is very important.
So if the question I asked though was it offered? Did Chesprocott have the opportunity, instead of asking for a new building, where they said, instead of giving you a new building, how about you have offices and town hall, so
Well-
that they could then provide the same service you're saying South Central wants to give?
No, it wasn't offered, but
Okay.
there was they're paying rent currently, would have to be looking for a new building, wanted to build one. That was made very clear to us.
The overall cost savings per year do appear to be minimal in consideration of the large town budgets. Has there been a guarantee made by South Central? Have they given you any kind of commitment to not raising those rates that Mr. Kimball showed us in his presentation?
I cannot speak to that. I don't have the answer. Perhaps staff does.
No more commitment than Chesprocott has that they won't raise their fees. There's no certainty on that.
Final thing, given what we have all gone through in the past 3 years, is it really appropriate at this time to seem to place dollars ahead of public health?
For me, that's kind of a dog whistle. We're not eliminating public health or its attention to every detail. Thank you.
Good evening. My name is Matt Long, 50 Autumn Court. I'm a little nervous, so I hope you'll
That's
bear with
fine,
me
Matt.
this evening.
Don't be nervous.
I've been a volunteer at Chesprocott for this past summer. I'm also a Cheshire High School alum, class of 2020, and I'm a senior at Quinnipiac. I also believe that as a Cheshire citizen, it is in our town's best interest to remain in a robust health district that provides vital services for its citizenry including health education initiatives and vaccination clinics. Over this summer, I got the chance to help set up the fall vaccine clinics across Cheshire, Prospect, and Wolcott. As the planning and process commenced, I began to properly appreciate the scope of such a project. Vaccines had to be ordered based on the vaccination numbers from the previous year. Locations had to be selected and contacted. We had to get up to date with how to upload vaccination data to the state, not to mention prepare the great variety of supplies that would need to be transported to and used at clinics. This massive undertaking was made much smoother and painless by the Chespercott team's experience. We had well-organized data on the numbers from last year's flu clinics. Maura had contacts for who to try and reach out to at each location. And everyone as a team had things to make sure we didn't forget to bring to clinics, from sharp spins to hand sanitizer, Wi-Fi hotspots to alcohol pads. Now, what is the upshot of all this work? Well, when I was at our Elam Park vaccination clinic last week, I asked one of the employees how many flu clinics they did for the fall. And they said 2. The one we did last week and the one we're doing tomorrow. We are on track to vaccinate well over half of Elam Park's residents. Without a Chespercott flu clinic next year, that population could either find themselves going without a flu vaccine, having to drive to a pharmacy to get a vaccine, or have their family members drive them to get one. And that's assuming that they are given a sufficient reminder to do so. Additionally, withdrawal from Chespercott gives up Cheshire's status as a regional leader in our current health district and abandons Wolcott and Prospect. With COVID, we saw that we are not safe from public health crises. And at such times, we need a strong health department, one that will fight to get us vaccines or whatever medical care we require, not one that will put its hands up and say we only do inspections. Also, as I've explained, such rollouts are large undertakings that require experience. So in such a crisis, a vaccination clinic can't be randomly and quickly assigned. The fight you've seen from the Chespercott team this evening and will continue to see is the same energy they put into fighting for the health of the people of Cheshire. And as someone who was in school, Cheshire High School, class of 2020, I'd like to remind everyone that the pandemic response was not adequate, not across the town, across the state, across the nation. There's no reason to be trying to cut costs when it comes to public health. Thank you.
Thank you. I gotta get the timer on.
Good evening, everyone.
Good evening.
My name is Peter Viltragus. I'm with Team Sewer Water and Septic. I use Chespercott probably 25 to 30 times a year. And I can understand some of your concerns. You guys have, it's a business, you have to run that. And I've dealt with them for that long. And I can tell you, years ago, obviously, this is why you brought this up. It's kind of been up and down a little bit. Obviously, there was some health people moving in and out of the positions and that kind of thing. But I can tell you, I think maybe some of the people that left probably maybe shouldn't have been there based on my knowledge and what I've seen when I've been in their office. And I don't know, I wouldn't say they're maybe the weak links or that kind of thing. But I've had a lot of history in this town. I've done a lot of work in this town and in the other towns that they work in. And I really think you guys really need to look at that again, just because of the fact, if you look at today and how they conduct business, you know, there was other times I understand there was some issues and I've seen it firsthand, but I can tell you today that they are a well-oiled machine. They're very knowledgeable. The turnaround times are a lot better than I've had in the past. So I think that whatever problems maybe had in the time, that they're doing a lot better. And like I said, it makes a big difference for us as well, that I can get a plan approved. We do septic, and to get a plan approved in a timely manner so we can get out there to take care of our customers. So I don't know about as far as dollars and cents, what it is. I mean, I work in probably 7 health departments, and you know, the prices are all about around the same. So, but I could tell you the level of service that you're receiving today is really good for us, to turn things around and be very knowledgeable. And there's some newer members that have come into there are very, very knowledgeable in what they're doing. So it makes my life a lot easier. So if it means anything, just if you could guys take the time, look at and compare apples to apples and see which really you're getting, whatever, maybe interview some of the people there and see how legit they are. And I think you'd be, you know, very surprised.
Thank you.
Thank you for your time.
Hi, my
Hi.
name is Margaret Hardner. I live at 1026 Amherst Place. I'm a taxpayer and an MRC volunteer. And I'll just leave it to the questions, follow the directions here. So first of all, I have a question about vaccines. I saw the presentation that Mr. Campbell gave. I didn't see any references to vaccine clinics. Maybe I missed it. Certainly, the flu clinics are extremely important, especially to our seniors. You know, having participated in these flu clinics just recently, I was at one. And one of the seniors who was standing in line said to me, look, I was a nurse in public health for 60 years. And I feel like I've saved more lives than if I had been an ICU or ER nurse. So my question is, what is the plan to continue those clinics to serve our seniors, our students, et cetera?
That's a very fair question. Mr. Kimball?
So again, I think one thing that's important to recognize is part of the proposal of joining the South Central Health District comes with Cheshire joining an almost 30,000 population times that per capita of a little less than $10. That added infusion into their budget would allow them to increase staff to service the expectations and the needs of Cheshire, right? So they are doing those clinics. We did reference the COVID vaccine clinics they did for first responders and the like in the community, and also the partnerships. The choice they made was to partner with Hartford Healthcare and Griffin, and also to utilize the Oakdale Theater location, which was a very popular COVID vaccine clinic. But also what you're referring to are those now seasonal. Again, obviously COVID is tied in with flu at this point. I just got both of mine last week at the same time in the same arm, which was not necessarily the best idea. But I will say that they are absolutely committed to providing the same level of community outreach with respect to your vaccine clinics at your senior centers, at your Elam parks. Again, the individuals that work there now did many of those same things during their time here in Cheshire. They know our expectations and the community's needs. But what I was saying earlier about the per capita increase, again, they're not only increasing from the $6 to the $8.75 or so next year, that will be adding additional budgetary funds to their overall budget. That's their other member towns of Southington, Plainville, Middlefield. But in addition, the with Cheshire adding on, that's what allows enough funding to hire more individuals, more nurses, office assistants, sanitarians, everything to make sure our expectations, which we've made very clear, are maintained at the same level they are now or better. So that's our expectation, and that's the commitment that they're making to us.
Okay, so they are committing to continue flu clinics.
Yes.
Yes.
I
Yeah.
just wanted to, yeah, we referenced.
Is that too
the
long of an
public
answer? I'm
clinics. I
sorry.
just wanted to be
Apologize.
Very specific about that. Okay, and the other commentary was on the MRC volunteers. Looking at their website, two things that I noticed. So thank you for clearing on flu clinics, because those were, here's our calendar of events, which was blank. So there was reference like we will have flu clinics, but there was nothing on their website. The other thing that was missing was volunteer with us, and there were no links on that page. Okay, so I understand you're referencing a larger community that the MRC volunteers can participate in. I didn't find that to be the current case, so I'll just make that statement. I'm sure that you can't currently respond on that without speaking with South Central.
Well, I just know I can't speak for exactly what's on the website, but I know that, again, they are a member of the Capital Region MRC.
Mhm.
I know I went to the Capital Region MRC website as part of our due diligence and research into this proposal. Again, I would encourage everyone to go to that website and see the opportunities. They have staff that help coordinate the trainings and the additional educational opportunities for the MRC volunteers. I saw on there the number of participants from area towns. I saw Southington had, I forget, it was 50 or 60 members,
Mhm.
Southington residents, for instance, that were in the Capital Region MRC. So again, when it comes to Cheshire's opportunity, And again, I can't say this enough. I hope every single MRC member for Cheshire continues to volunteer because you're serving your town. It's not serving Chesprocott per se. You're serving the town of Cheshire and volunteering your time to protect the public health for the community. And that is unchanged. If you join the Capital Region MRC, it's simply a redesignation. It's the same oath that you already took. And so I just want to make sure there's that comfort level that this isn't a loss of opportunity for the folks that have been heretofore participating in the Chesprocott MRC.
Thank you for answering my questions.
Thank you very much.
Hi, my name is Sandra Wade Amon, and I live at 381 Westland Avenue. Are we just supposed to be asking questions now, or?
No, if
moving-
you want to commingle a comment when you finish your questions or get your answers, that's fine.
Okay, so it doesn't.
Yeah.
Whatever. Okay, so so I'm a pharmacist and an emergency preparedness volunteer and a member of the Chesprocott MRC, which is Medical Reserve Corps. Since 9/11, I've attended many emergency preparedness meetings and training exercises. Since 9/11, first responders, together with community emergency preparedness volunteers, have participated in point of dispensing exercises and drills. And back since 9/11, we thought we were going to be dispensing medication, and antibiotics for anthrax. During the COVID pandemic, Chesprocott was able to quickly and efficiently mobilize a couple dozen volunteers and increase their volunteer base to several hundred volunteers. Chesprocott was therefore able to offer the community COVID vaccine clinics promptly starting in January of 2021. Yes, now folks can go anywhere to get vaccines, including pharmacies. They can go to Bradley Memorial Hospital if they want. But I believe that Chesprocott had an impact on the lives of many senior citizens who were able to get their vaccines during the winter of 2021 in town at the Pool Clinic, this Elam Park, the senior center, and drive-through clinics offered at Cheshire High School. If you remember, the idea was not to increase people's individual exposure by going to hospitals such as Bradley Memorial, where they would be exposed to hospitals. And as you mentioned, the Oakdale, that was a huge clinic. Okay, our seniors were much safer at Cheshire Senior Center with maybe 20 people at most in the building than being exposed. So to disband Chesprocott, while COVID and the vaccines are still current, I believe is foolish. We trained for this emergency and it worked. It worked really, really well. Chesprocott saved this community a lot more than $126,000 in terms of human suffering and lives. Furthermore, in the light of current state of the state of current world events, okay, meaning Russia, Ukraine, the Middle East, if radiation were to come raining down on us, Chesprocott could mobilize and dispense iodine pills, I believe, within hours, not even within a day or two. We could pull that together within hours because we have the experience. And to disband that, I believe would be throwing away more than it is worth it. I guess I'm out of time, huh? I'm not out of time? Okay. Okay, I believe Cheshire is best served by being the lead and largest town of Chesprocott. If we go with Southington, I heard that we would have 3 representatives and Southington would have 4. Let's see. Chesprocott is also part of region number 2. The state is organized into several MRC regions. Southington is at the southern tip of the middle of the state, which goes all the way up to Avon. I do not believe your Corps of Volunteers is going to go to training exercises all the way up, near Avon. Region 2 includes the Naugatuck Health Valley District. It includes Wallingford. I participated in point of dispensing exercises with those towns. And I think your Corps of Volunteers, might stay tied to Prospect.
I think I thank you for your comments, and we'll, if it's possible, we could save a little more time for others so they can
Okay.
speak.
All right. I just, I don't know. I think the town is best served by staying with Chesprocott. We have a long history and we have a lot of experience, and we really don't know anything about Southington. I was recently at the Yukon Pharmacy alumni meeting, and I met a colleague who was a longtime resident of Prospect and was also an emergency preparedness volunteer for a long time. He retired and moved to Durham. He said that during the pandemic, Durham and MRC included Middlefield MRC because Southington did not have an MRC. They didn't have a program. And he said, Southington's a mess. You don't want Southington. That's the feedback I got by just asking around. So thank you.
Hello.
Good evening. My name is Leah Crown. My address 165 Miller Street in Meriden. So I'm the Director of Health and Human Services for the City of Meriden. I've been with that department for 17 years and in the position of Health Director since 2015. Since 2017, the Chesprocott Health District and my department in Meriden have combined resources, including financial, staffing, and expertise, to establish a comprehensive public health emergency preparedness program. This includes partnering on drills and exercises, responding to real-world events, including COVID-19, in which none of our offices shut down. We were there 7 days a week for almost 2 years. We shared plan writing and sharing of documents, and establishing a regional distribution site for Region 2's strategic national stockpile or state deliveries. The district, Chesprocott, has an active medical reserve corps, which we've heard a lot about tonight, and Meriden doesn't have that, ready to assist Cheshire in the event of a public health emergency. What I've learned from medical reserve corps is when they go to a larger agency, they want to respond local, right? The first response is your local response. They're not going to want to go to other locations, and other people from other cities usually don't want to come in. They want to be homegrown and stay where they are. I've worked with the MRC on multiple drills and exercises, and just from sharing things and just, being passionate about public health. And this group really is dedicated and passionate about saving and protecting public health in their community. Our partnership between our two health departments goes beyond emergency response. We combine health education efforts to hold that QPR, suicide prevention trainings, naloxone trainings to recognize and respond to accidental overdose, and most recently, it's running now, a media campaign to raise awareness of the importance of keeping up to date on vaccinations. We do all of this with a public health lens, with data that really only local health departments can obtain. I urge the Cheshire Town Council to maintain your established relationship with the Chesprocott Health District. They have over 47 years of collaboration and providing essential public health services with city leadership, police, fire, EMS, schools, businesses, daycares, community-based organizations, long-term care and assisted living facilities, and healthcare providers. They are a valued resource in this community. The town would be jeopardizing this collaboration as the demands of public health continue to increase. It seems like every legislative session, more and more gets piled on public health. All of this, by leaving the district, it would save you 0.09% of your operating budget, if in fact that 126,000 is the number. Very, very small amount for such a huge change. Chesprocott is a professional department staffed with trained and certified personnel with expertise in a wide variety of public health areas who are dedicated to providing the 10 essential services of public health to your community. Thank you.
Thank you.
Hi, good evening, Town Council. I'm Karen Bule from Cheshire and Westbrook. I've dealt with Maura about a long time. I was green when I first got my real estate license, and they educated me, especially Lorraine. So I'm here tonight because on Monday I had such a crisis that if that woman wasn't here at her job, I'd be in trouble. Our owner, not that I favor him, left my tenant in a pool of basement feces and water. okay? And nobody was going to report him because they were scared. Well, I took the seat and I reported him. Maura's got someone, we have someone on Friday coming out. Couldn't do it faster, okay? That's one of my very, very special things to her. They really help when you need them. Second, I was just a question. You're doing the social services office over downstairs. And why isn't other than the building department, why aren't we offering it to Chesprocott? I heard the building department's going in there.
Well, I did basically answer that to someone else.
Oh, I didn't hear you.
It may
I'm
not have been
sorry.
a satisfactory answer, but they weren't interested in our estimation, anything but building a building.
Okay.
That was a dedicated statement that was made.
Okay. I
And
didn't hear you.
ongoing,
I'm sorry.
ongoing. Well, that's fine.
Yeah.
That's fine.
I didn't hear the answer. The other concern I have is I was back and forth in a hospital at Midstate for about 2 years with a family injury. And if I couldn't go to their clinics to be tested, I'd be waiting forever at Midstate. So that's one concern that I do have. I never got the COVID, so I was lucky, but I still was always tested. And then the final comment I have for you is, we were at an RTC meeting and we were listening to, the board and stuff, and they were saying that we may save 100,000 with them going out into Southington. Is that really worth it for all the citizens and everybody? Because my dad was a developer in Southington, so we dealt with that district. And I'm going to tell you, this one beats them all. That's all I got to say.
Thank you.
Thank you.
Good evening. My name's Deb Kazis. I'm at 432 Oak Avenue here in town. I've been a resident for about 30 years. I'm a community health professional, and I was the community health educator from 2015 to 2017 at Chesprocott. I actually completed one of the community health assessments that was mentioned earlier during my time there. I was fortunate to be a colleague of Susan Lonzak, who at the time was our chief sanitarian. And I'm here tonight to speak in support of Susan and tell you about the great confidence that I have in her ability to lead a health district that Cheshire might have the pleasure of being part of. Susan is a highly qualified and experienced public health professional. Her extensive knowledge of the many facets of community public health has always been impressive to me. She has a deep understanding of the challenges facing our community, and she's deeply committed to developing and implementing innovative solutions. I can tell you that Susan is committed to building and maintaining strong relationships with her staff, colleagues, and stakeholders, including the residents of the communities she serves. I have a great faith in Susan's ability to lead the town of Cheshire into a more healthy future, and I thank you for the opportunity to speak. Thank you.
Hello, I'm Liz Normans. I was chairman of the board most recently. I live in Prospect, and I just had a question. I have a whole long speech, but in lieu of time, I'm not going to do that. I just have a couple of comments and questions. I'd like to know, how big is the Southington South Central Health District? How many towns?
It's currently 3 towns.
3 towns, and how far does it go up to? You said Avon?
No, that was a reference to the MRC
Okay.
district,
I'm
which was
sorry.
41 towns.
Huh?
That was 41 towns, I believe, that was comprised in the one that they're,
Okay.
right.
Well, the biggest-
South Central is made up of Southington, Plainville, and Middlefield.
And
And where?
Middlefield.
Middlefield, okay. Being part of Prospect, I love to come to Cheshire to do just about everything aside from being on the board. I'm very proud of the work that I've done on Chesprocott as an MRC volunteer. I've been on the board for almost 15 years, even before Maura was there. And I can honestly tell you the district before Maura was in the red all the time. The money that we have was going to be for a beautiful building and state of the art because we were running out of room. We were so crowded. And while I agree it's a great thing to have a building here, the building, what we want is something where the whole town, including Prospect and Wolcott, can be a part of. I feel that Cheshire's going to get lost in the shuffle if we move somewhere else. This whole town is going to get forgotten if we move to Southington, no matter who you have over there for us. But being here in the center, this is a huge town. Prospect and Wolcott are small towns. And I really don't want to reinvent the wheel again. I like what we have here. I like what Chesprocott has done for me in my career. I did my whole doctorate thesis on Chesprocott and the pandemic. I would hate to see us lose our relationship with Chesprocott. And I think if you look at everything that we do, like everybody said, $100,000 isn't a lot. And we're all willing, to work on the budget as you give us direction. And I was ready to meet. I hadn't heard anything since November. I was ready to meet with you. And nobody ever got back to me about a good time to meet. So I apologize for that, but I hope that we can prolong this vote and meet with you in the future.
Thank you.
Thank you.
Good evening. My name is Tom Grimshaw, and I live at 470 Riverside Drive. I used to work at the Meriden Wallingford Hospital, and I worked under a system called continuous quality improvement. And these are opportunities. And my wife and my daughter played a major role in this Chesprocott system here. And so I asked them, and they said, well, it'd be sad to see it go. But I said, look, let's see the opportunity. And so after examining the opportunity and the savings that's involved and the increase in the power that could be gathered by joining a larger group, if you do it right, it'll work. If you do it wrong, it'll be a disaster. So my suggestion is you measure everything. You measure patient satisfaction, and which is the key, and through continuous quality improvement, the old Meriden Wallingford Hospital went from 4th percentile to the top hospital in the country. And that's because we utilized our staff to build every service that we had. So I hope that you take it as an opportunity to look at, but be very careful and measure everything. Thank you very much.
Thank you, Mr. Grimshaw.
Hi, good evening. My name is Catherine Yakavone, and I live at 15 Copper Valley Court in Cheshire. And thank you for having this hearing tonight so you could hear from the residents. I think it's very important on this matter. I've been in the healthcare delivery business, I guess you could say, for over 40 years of making accessible, affordable, community-based care available to all citizens in Connecticut, particularly in underserved areas. And I've worked with the state health department, many city health departments, and Chesprocott as well, and its director. Public health infrastructure in this country has always been underfunded. The federal level, the state level, and that trickles down to the local level. And yet we know that the best strategy to assure residents receive public health information, resources, and services is the best local community-based placement for those resources is the best way for the public to have the secure knowledge that there is a place to go for public health, especially during the pandemic, correct? The public health awareness then gets really aroused. What do they do besides flu and, now immunization? So I think it's essential for us to be very mindful of how the public views public health. And we know that it can do so much more, as we've heard tonight, than current resources may provide. I know what it costs to run a health infrastructure facility and an office, and fixed costs, staffing costs, administrative costs, supplies. It runs the whole gamut. And I know when you have staffing shortages, it's very hard to meet the needs of the population you want to serve. I know that the Chesprocott revenue streams are diverse, including the per capita dues. And I understand the necessity for the town to balance a budget whenever possible, to look at where they can lower costs. However, I would say all of my years of experience would lead me to ask you and to consider the withdrawal of Cheshire is based not only on expenditure, but on the consideration of public benefit, which you've heard tonight. Joining the South Central Health District may lower the cost, but as many residents have said tonight, it also may result in a different distribution of resources. Even if they hire one more staff person, you're distributing those resources over a much larger population base, given the size of Southington, Plainville, and you add Cheshire to that. So by just numbers, that distribution will affect Cheshire, and in my view, perhaps not as well as the service that we have now. I've come to understand that the leadership of the Health District of Cheshire Health District and the director were not fully aware of the full considerations the board was, the town council rather, was bringing to the public in really a very short period of time. They really were not given the opportunity to discuss all of these factors with the council. And I would hope that the council would sit down with all the relevant stakeholders and have much more of a sufficient dialogue. And I appreciate the opportunity tonight to make my comments. My question is, what is the timeline for a decision by the town council? I mean, does this have to be made tonight? Can this wait? My understanding, maybe I'm wrong, was if the district was realigned, it wouldn't take place till 2024.
Well, to your point about there is actionable action to be taken tonight on this by the council. There is a period of time, a timeline, where we would maintain our partnership with Chesprocott until June 30th. And then after that, be in the other district. That's just a timeline that's sort of dictated, perhaps further explained by the town attorney or Sean, but sort of prescribed by state statute, I believe. July 1st.
So in my understanding,
Right.
Mr. Chairman,
And our notification has to be by December 31st. So we're following sort of a scripted departure plan, described by state law.
I don't think most of us understood that time frame, and maybe we wouldn't have had the opportunity to understand that time frame. But my only question would be, is there more time then for thoughtful dialogue with all parties, or there has to be a decision tonight?
Well, we put it on the agenda for action tonight. There's 9 of us up here listening to all the comments. I can't make any prediction, but there will be an opportunity for us to vote tonight.
Thank you. Thank you for consideration of my comments.
Hi, I'm I'm Reverend Amy Johnson. I'm going to speak from my role as a pastor at a church and what I've seen. But first I'll say I live at 160 Patton Drive. I'm not a pastor in Cheshire, or you'd probably know me by now. I'm a pastor in Canton, Connecticut. But I've been an ordained clergy person for over 20 years. I guess what I want to speak to is the most vulnerable in our populations wherever we live, which is often the elderly. And the thing that impressed me the most when I read through Chesprocott, I'm a little nervous. I don't like talking in public. I'll get in a pulpit easily, but this is not as much fun for me.
When I read through the Chesprocot statistics and what it offers, the thing that impressed me the most was the full-time nurse who will go into elderly people's homes, shut-ins homes, those with disabilities homes, and service them in their homes. This is an invaluable resource, and I can tell you that because the church I serve is next to an assisted living place. I don't know what the title is, but the town helps sustain, the people there are low income and often in great need. Some of them attend my church. They don't have a lot of family often. They don't always have ways to get places. They can't drive often. It's sad, basically. You know, we as a church do as much as we can, but we are not a public health facility. So I feel like it's really important to keep that as part of what Cheshire offers the residents here and whatever other residents like Prospect, Wolcott, wherever you guys decide we end up. Does the SCHD have such a person that can visit people in their homes, particularly here in Cheshire?
Sean?
Yes. In fact, it's the same person that was doing it in Cheshire for Chesprocot. The
They have
nurse.
a full-time,
They have Aria Swan, who was the public health nurse for Chesprocot, is now and did homebound. Again, Maura, correct me if I'm wrong. And now she's working for South Central, and that's part of her expectations of job duties.
Chesprocot Health District has a clinical license, and we have a medical director because you have to have orders. I do not know, I cannot speak for South Central if they have those capacities.
So
Yes.
they've told me that Aria does the homebound, just as she did with.
and can she do vaccines and things like that? I guess I'm just concerned that it won't be the same services.
Right. I understand the concern for sure. And again, I can follow up for more specifics. I don't have them all off the top of my head, but I know that is an expectation again of Cheshire's and something we have made clear to them as we expect the same level of service or better with our next health district should we change.
So then I have two other questions. One is if in fact they are not currently providing the same level of services that we have in Cheshire, won't it raise the cost of providing what we've already received here? In expecting them to rise to that level, will that not in fact increase their costs to do so? If they're not already doing what we do here, then they have to add those services. And that
We do
means
bring revenue to the table.
And our revenue that's currently going to Chesprocot would then go at a slightly reduced rate, but still in the order of magnitude of $300,000 would go to South Central as part of their.
But they're also
overall
adding a
operating budget.
whole other town. So it's not like they're increasing their budget. They are,
Right.
but they're increasing the number of people they serve as well. So it's like a flat line.
But they already have part of regionalizing services, part of the cost efficiencies you enjoy are a sharing of those services across your towns. They have a medical director. I know that was a question you just asked.
I see what you're saying.
So they
Yeah.
do already have those. We're not having to pay for a medical director just because Cheshire's joining their district. Does that make sense?
Yes.
So, okay.
So then my other, and this is so not my field, so please forgive me if I don't sound intelligent when I'm talking about this stuff. My other question is, if you have to vote tonight, can you not vote to delay the vote?
That's a question for me.
Yeah.
The council can make a decision on that at the table. Yes.
Oh, okay.
Yeah.
Great. That is wonderful news. Thank you.
Thank you to the council for considering what is obviously an emotional issue. At the same time, leadership means decisions. And I'm pleased to see this council take on something that's requiring a decision, ideally to reduce costs, reduce taxes. I would encourage the council to continue to do that across all facets of our government in this town. And I'd like to suggest that if you do that successfully, that you use that as a template to give to the assembly in Hartford and show these clowns, my apologies for saying that, to how to reduce costs in this state. Because all I've seen in the 10 years I've lived here is nothing but higher costs. Thank you very much.
Thank you. No, please.
Hi, I'm Jennifer O'Neill, 53 Troutbrook. I apologize. I just found out about this topic tonight about 6 o'clock. Brought my daughter with me so she could see how government in our town functions. But listening to the presentations tonight and everyone speaking, she started kindergarten in August of 2020. And I had my fourth child in September of 2020. And I was terrified of her being in kindergarten with a newborn at home and COVID. The vaccines that I was able to get for my kids through Chesapeake Health District were invaluable in terms of my feeling comfortable with her being in public school. And I'm sure the coordination with the masking and the podding and all this stuff that was done through the public school system when she started gave me good peace of mind that she was safe and she wasn't going to bring something home to my newborn, my 2-year-old, and my 4-year-old that I had at the same time. I'm a contracting officer for the federal government, which I've been doing for 15 years. So I'm well versed in prudent spending of federal and all tax dollars, but federal. The additional cost for Chesapeake, the 6 members in my family, we're willing to pay that. So for what it's worth. Thank you.
Kenneth Amon, 381 Westland Avenue, since 1991. I'm a pharmacist and a Chesapeake volunteer. As such, I will speak to Cheshire's role in emergency preparedness only and its value to our community. My wife and I have been involved with our town's emergency preparedness since 9/11. Back then, the biggest concern was a possible terrorist attack with chemical and biological weapons. Do you guys remember the panic? Was there anyone here who did not worry that an envelope full of anthrax would show up in their mailbox? At that time, Chesapeake began to formulate plans for the mass dispensing of antibiotics to the townspeople that we called the worried well. The goal was to accomplish this, virtually the entire town, in 36 hours, a monumental task. Over the years, I witnessed step by step through countless meetings, tabletop exercises, and finally, full exercises in coordination with the fire and police, the creation of the program designed to medicate everybody in town. A program 20 years in the making that resulted eventually in the formation of our group of volunteers called the MRC. Thank God we did not need that service. But it is my opinion that it was the foundation that enabled us to quickly pivot from mass dispensing to mass vaccination. Despite being given the use of inadequate and dangerous facilities, namely that concrete monstrosity known as the pool, we were able to vaccinate thousands of residents twice and sometimes even more than twice, possibly saving hundreds of lives. I repeat, this was all done in our town by and for our citizens. During these 20 years, change happened. Plans changed, people came and went, but the institutions remained. It was our rock until now. All of a sudden, our town manager has 126,000 reasons to take away what we have built. My comments on the projected cost savings are 2 sayings. You get what you pay for, and if it sounds too good to be true, it probably is. Speaking for myself, I can't imagine volunteering for a leader who not only left my town, but then took my health district with them, leaving me with only a satellite office as a consolation prize. Consider where your savings will go if you have to replace most of your volunteers with paid staff. The next emergency is coming, and you will need them. Almost done. My message to the council is this. You've truly tapped grassroots here. This will be an election issue, and I urge you not to railroad it. My message to Southington is to find another town to poach. Finally, for Mr. Kimball, my message is to man up, negotiate with the board in good faith, and do not allow the health district of the people, by the people, and for the people of Cheshire to perish from this town. Thank you.
No one will perish, but thank you for your comments.
Hi,
Hello.
Diane Visconti, 795 Devonwood Drive. I'll start with a question. What happens to the money in reserve at Chespercott if you leave?
Typically, it's my understanding at least that the reserves are apportioned by the ratepayers' population count, head count, if you will. So Cheshire leaves with a portion of that. I believe that's an accurate statement. So
Are you counting that money in on
not our
why
money.
you think it's a good idea?
It's not our money. It's the district's money. So it could only be used for the district we're joining. So it's not, it's money that was collected through taxes, but paid by the town to go to the district. So there's a transfer sort of payment. Sean?
Yeah, I mean, the funds of Chespercott are, Chespercott exists as the health district for the 3 towns. So if Chespercott were to disband, then the funds would be redistributed back to the communities that are members.
Okay. Well, I want to say I served on Chespercott's board years ago when we had to fire the director. And I certainly have learned how important a well-functioning health district is. We've learned from COVID that public health emergencies happen, and we learned that public health is political. It's political in that different people have different ideas on what a health district should offer. What is our view here in Cheshire? Should we continue offering vaccinations and preventative services at their current high level? What services might we be eliminated if we leave Chespercott? I've read Chespercott's minutes from the last year, and I saw no open discussion of Cheshire leaving or being unhappy with the current situation. There were several executive sessions, so perhaps it was discussed there. But my understanding is that this decision to leave was not held with the current director. This seems odd to me, as you would think she would have had valuable input. In fact, the board of Chespercott gave her a bonus after COVID because she did such a good job. And also, I find it a little bit odd just to have our town manager on the board because I think there's a conflict of interest there. If we want a town to support an independent and vibrant health district, we should support an independent board. Of course, this is not to imply that Mr. Kimball is wrong in suggesting more cost-effective ways to provide services, just that he should do it without hurting the board that he sits on. Why not let this be an election issue? Let's have the voters weigh in on how they want their public health delivered. Let's have candidates explain their views so that we can make an educated decision. The election is only a few weeks away. What's the hurry?
Mrs. Conti, please, no applause for anybody really approving or disapproving. Mr. Conti, I would like to address your comments and your statements. Number one, Sean Kimball was appointed by the council and exercises a legal and lawful right at no conflict of interest. As stated and as stated in the state's own guidelines on welcoming such officials to their boards.
All right, I'll explain my comment. Some boards do have town managers be on the board.
Right.
That has never happened in Chespercott before this.
Yeah,
And
but
my
it was-
concern is if you're on the board of Chespercott and you are also the town manager and a question comes up on and what's best for Cheshire or what's best for Chesprocott. They might not be the same answer. And so if you decide you're going to vote what's best for Cheshire, then are you a valuable board member? I think it could get tricky, and I'm sure you want to argue about this.
You know, Sean
And I'm
brought
not
to
s-
the
I know.
Sean brought to the table, quite honestly, what I think a selected board would like to have. Finance experience, which is invaluable to the town council. We're as town manager, Sean Kimball is our hire. Okay.
I
We
understand.
get to hire the town manager. We have nothing to do with town staff. That's his role. So he gets our ear, we get his ear, but nobody else gets our ear in town hall. Okay. Similarly, he gets to lend his talents and skill set to a board. Whether they're willing to listen or not is the question.
But it just seems after having a relationship with Chesprocott for almost 50 years, that this would happen and it would come as a surprise to the director of health here and the two other towns. I don't think we're being very good neighbors, and I don't think we're being very fair to a woman who worked extremely hard during COVID and all the volunteers who helped. Thank you.
Thank you. Hello.
Good evening. Good evening. Ronald Fioro, 832 Cornwall Avenue. I've been a resident for several decades, and I can't add much to what's been said here tonight, except to say that Chesprocott has been a positive force. For all the years I've been here, all my dealings with them have been extremely positive. And in the words of a famous philosopher, if it ain't broke, don't fix it. Thank you.
Good evening. I'm Marge Chapman, 15 Stonehenge Place, Cheshire, Connecticut. I did not intend to speak tonight. However, I do have two questions, and they're very simple. I'm not giving speeches. My two questions are, why the apparent lack of transparency and fairness in evaluation that appears here and that many have spoken to? And secondly, why the timeline? Why can't we learn more about this nascent health district, which in fact, until, at least I looked on the website, I think until September 15th was not the, whatever they're called, the South Central Health District. It was the Southington Plainville Health District. So this district hasn't even existed a month. And yet we're going to sign up for it on this very short timeline, which I understand has to be decided by December. But if we weren't doing it this year, it wouldn't have to be decided by this December. So those are my two questions. You may answer them, or you may just contemplate them as you consider postponing this vote. Thank you.
Thank you.
Robert Cotto, 1146 Wilford Road. As a resident and taxpayer, I think you guys are doing a fine job of looking how to save us money. From what I hear with a lot of businesses in town, problems that they have with Chesprocott, the cost of the fees going up, who has to do some of the work, being in town meetings here, Board of Ed, Planning and Zoning, Town Council meetings where we've asked questions and there's never an answer coming out of Chesprocott. Sometimes not even having individuals at our meetings or at meetings that need to be there to answer these questions is an issue. I also have a relative that's on a health district in Connecticut, someplace else, and South Central is recognized as a very good health district. So I think it's prudent for you guys to save us money, and even developers and people who live here that need to pay those fees to move on and to save us some money. So great job. Thank you.
Thank you. Ooh.
Hi, I thought of two other questions. It was my understanding that Mora was pursuing state grants for a new building, for the new facility. So why isn't that being mentioned, and why are we saying the taxpayers are going to pay for it? And the second concern is, it's my understanding that Southington's nurse is being paid for by a grant, which will end. And so why are we comparing, them having a nurse to us having a couple of paid nurses. It seems like we're not really comparing apples to apples with these two concerns.
I don't know the answer to that question.
It's, yeah, to address the last question, that the nurse position is a board-supported permanent position. It's not, if it's implied that that's a temporary public health nurse position, that's not the case. And South Central has assured us of that.
Good evening. Ann Harrigan, 720 Ward Lane. I don't have a prepared statement. I really wasn't intending to speak tonight. And other people have said what I wanted to say very cogently. So I will just add that for me, as a citizen of this town, the most important thing is that our underserved populations get the opportunity to be served all the time, not just during big crises. And when I talk about underserved populations, it's the elderly, certainly, the uninsured, the children. And I just want to say, I've seen how Chesprocott has gone out and they go to the people. They don't make the people line up, come to big places during pandemics. And I just think that's very important. And I would like our town to continue to offer those kinds of services, that kind of outreach that goes to the people. And I just think that this decision is being made very hastily. And I would just like to further the conversation, the dialogue around this issue before jumping on board with another health district. So thank you very much.
Thank you.
Hi, I'm Stanley Emmond, 2060 Waterbury Road. I've been in town for decades. I've dealt with both health districts, Southington and Cheshire, with a good experience from both. So I say, if you can save the town some money, kudos to you guys. Do what you have to do. Thank you.
Thank you. Anyone else? Okay. Last call for anybody else. Sure. We do have another public hearing, but there'll probably be fewer questions.
I will be brief.
Go ahead.
I'm Alita Looker. I live at 139 Cook Hill Road. I've been in town for probably some of you weren't even born yet. I only have one observation to make, and that is this. Last year, I believe, unanimously chose to become part of the AARP age-friendly community. Chesprocott has been age-friendly for a heck of a long time, and I'd hate to see it gone. I have worked with them. I was benefited greatly. I was one of the first people that got COVID here, and they monitored my health back to a satisfactory level again, and I wouldn't want it any other way. So be sensible. And remember, this is an election year, and I'll watch how you vote.
Well, you're one of the finest former electors. I won't take that as a threat either.
Stanley Pilot from Prospect.
Hi,
I've been an
Stanley.
MRC volunteer with Chesprocott for 5 years, so I can attest to all the positive things that have been said about them. I just want to add that Chesprocott has their handle on a vast amount of volunteers, professional people that have been trained, continuously trained, and consider them like reservists in the military. Maura has the ability to immediately reach out to a number of people to handle who knows what's coming down. And the world is at a bit of a shaky period right now. So our three towns depend on that stability to be able to reach out and help all the people in the community. On another point, I'm also a member of the Prospect Town Council. And I, like everybody else, has been notified about this change about 5 weeks ago. So we weren't afforded the opportunity of discussing with the council members here as to how we would plan and how it affects us and the town of Wilkett also. So we would like to have that opportunity. And I would request, as a member of the town council for myself, is that you don't take a vote, or you table a vote and have that discussion with us so that we can comprehensively plan the future, whether it's with Chesprocott or some other district. We're kind of scrambling right now to come up with alternatives for ourselves. We just don't know what's available to us. We have to start working with it because we were quite we're quite pleased and with what we've had with Chesprocott Health District. Thank you.
Thank you.
Mr. Chairman.
Hello.
Hi, I'm Brian Shane, 62 Hilltop Road. Like other people here, I wasn't really planning to speak tonight. In fact, I told myself, do not speak, listen to other people. But it really bothers me that you seem to be rushing to make this vote tonight. It doesn't seem to me that it is an emergency thing we have to do. It seems what we need to do most is to mediate this out. It seems to me that there are personality issues involved with the people that work for Chesprocott and now work for South Central, and money issues. And it seems to me that we can come to a more intelligent due process type of decision. I am an MRC volunteer. I have been for many years. I'm proud to say it. I've always found Maura to be a great person. Her husband's sitting here, right there. And I have to say that he's a great person too, and her family. And, I went to the Memorial Day parade a few years ago. I had to decide, do I march with the Democrats, I'm in the office, or do I march with the Chesprocott? And I had to make a decision. It was hard for me because I'm a loyal person. I like to be nice to everybody. But I chose Chesprocott. I guess it's because she was so personal, and they had a cookout, and we all got together and we rode on one of the vehicles from one of the farms. It was fun. And I love all the volunteers. We're like a team. And whenever I go to training, I feel it's just a warm, good feeling to be with people. And I feel Maura does a wonderful job. And I hope you're not unkind and unfair to her. I feel it personally. And I just wish that, I worked for the Better Business Bureau here and Consumer Protection. I've done mediation, and I told Sean Kimball, I'm willing to step in and sit at a table with people and just let's talk it out and be reasonable. I like having Chesprocott here in Cheshire. And I'm glad in a way that you're going to have some offices in the town hall to make it easier for people to come in and do their business. But I do think we should look at the bigger picture and try to keep it here in Cheshire. I'm proud to live here, and I hope that we can work together as a team. I like you all, and I hope that we can get the tempers down and delay this decision. And if I can help in any way, I'm willing to step forward.
There's
And I
no
wanna thank
tempers.
Maura and her husband and everybody.
Thank you, Brian.
And the great group of volunteers I've been privy to work with. So thank you so much.
Thank you, Brian,
Thank
very
you.
much.
Thank you.
Always a pleasure.
Thank you, Chairman.
Hi, my name is Karen Soders, and I wasn't prepared to say anything tonight, but just listening, I felt I had to speak. I am a registered nurse. I did start with the MRC in 2018, I think it was, prior to even know there would be a pandemic. So I have great respect for them for medical reasons. I had to stop, so I didn't participate in all their fabulous vaccine clinics. I did benefit from waiting in line with my car to get the COVID testing kits and the N95 masks. But I was just wondering, I really think you should slow down and postpone the vote, sit down with Chesprocott and try to come up with a better plan. I mean, has anyone, well, back to, so the two individuals who were, or three individuals who were with Chesprocott, they learned all their great things from Chesprocott. And they're brand new, taking off, they haven't been running that district very long. Has anyone spoken with the citizens? The people applying for the permits, like the gentleman here who spoke and said, everything was expedited quickly. Has anyone checked to see if people are happy with their health district? Also, that one part-time nurse is going to have to be increased to more nurses if they're going to absorb all the elderly in Cheshire, which we should be serving. Like somebody else said, we can't expect the elderly to go to Southington for their flu shots. It's a great service and we have a large elderly population, for them to be able to receive their immunizations where they live or close to where they live. Drive-through clinics. Also, besides MRC and immunizations, there are other things Chesprocott does that people haven't even talked about besides education. How about the restaurant inspections? I know they said that they will do those as well, but there's over 200 places that need to be inspected for food safety and regulatory licensing for hairdressing, etc. It took 4 people, I believe, from Chesprocott to conduct all I know it's over 200. Like I said, I wasn't prepared, so I don't know how many, but I know it's over 200 restaurants and etc. that need to be inspected. So that means that that district is going to have to hire that many more people to absorb our restaurants, nail salons, etc., nursing staff. So that's going to increase their costs. So currently, even if they look like their costs are better, they're going to increase. They're not going to tell us now, oh, gee, we had to hire this person, this person, this person, which will be the result.
We do largely anticipate that they have to meet the needs of the community that's being added, and they will have to hire resources to take care of
Right.
those.
So that
services.
cost
It's
isn't
completely-
included.
Well, it's recognized that we the ratepayers from Cheshire would be bearing that cost.
Right. So that you're not
Pay
really going
for
to
it.
be saving much, when we're going to be losing all the benefit of having the health district here. And so you're going to be decreasing that cost savings that you're mentioning, because the cost savings is current, not with, okay, wait a minute, we have to add 4 more people because we can't handle Cheshires with the one person we have.
I'll turn the answer over to, if you don't mind, to the town.
Okay.
Yeah, just for some clarity, the cost savings we're referencing is net of any other fees. We're still going to be paying fees. We're not saying we're wiping out all of the fees that we're currently paying at Chesprocott. In fact, we're going from the $13 per capita to an estimated $875. So the roughly $126,000 savings that I'm referring to, that's not, the $875 is still there to pay for all of the other services. Plus, again, as I said before, it's about a $2 increase for their entire district across the populations of Southington, Plainville, and elsewhere. So I understand where I think you're trying to go, but I just want to clarify the facts that there will be funding both from Cheshire's infusion into their district and any increases that they have to their current rate to cover all of the expectations of the services that we're referring to that you're talking now. So this is a net, that savings is net of an assumption we're going to be spending a not insignificant amount of money to fund those very positions. So it's not coming out of the top or anything.
So back to, has anybody checked to see how people are feeling with that district, the health district in Southington?
We've conducted no polls.
You've
We haven't.
I don't think so. But you're saying that there were complaints, but you're not telling us how satisfied the people are with the other health district.
I would assume that there's complaints in any district. I think that's reasonable too.
Absolutely.
to
That's
assume.
why I'm saying, maybe we should slow down,
Fair enough.
talk,
Fair enough.
continue the dialogue, and not make a hasty decision to stop what's working.
Okay. Thank you.
Thank you.
Any other questions? Comments?
Geraldine Rock, 11 East Ridge Court, Cheshire. I am an MRC volunteer. I am also a realtor, and I've been in this town as a realtor for 40 years. Over those 40 years, I have made numerous stops to Chesapeake to find out about septic systems, wells, perk tests, you name it, I've been there. I've gotten answers almost immediately on a lot of what I had questions about. My question to you is, who will be sitting in the satellite office at the town hall? What are their credentials going to be? Is there going to be a sanitarian on site that we could run to and ask questions to? And if not, how do we go about getting answers to our questions that we might have right then and there?
Mr. Kimball?
Yeah, so we've had conversations with the folks at South Central. Again, we will leave the overall management of the district and the decisions in terms of where staff resources are going to be ultimately to them with our input, of course. Our expectation is that you'll have enough staff in the annex office here to service everyday permit requests or license renewals or
How
anything
about
else.
inspections? There'll be somebody there to do inspections.
Right.
for
I would
us?
fully expect there'll be a sanitarian or two staffed in this building. But again, those decisions will be made over the next 8 months should Cheshire proceed with moving into the South Central District. But just know we're expecting to have at least 3 to 4 staff in a satellite location here in Cheshire. Not unlike, again, just downstairs from the room we're in right now, we host the regional probate court for both Southington and Cheshire. So again, this is a model that has worked for many years successfully here in Cheshire. And again, we have those staff resources here in Town Hall and provide an opportunity for Cheshire residents to make themselves available to those services. So again, there are overall, for instance, the director of the South Central District, I'm sure will stay in the Southington municipal offices, but they will be available to come again to department meetings. They may have a deputy director or something in the future. Again, we don't have all of the specifics and credentials, as you said, for who will be staffing this to be planned office. But again, I just want to reassure that those conversations have been ongoing and we'll have adequate resources here in Town Hall to provide that
Well,
level of service.
we have excellent staff members here now. I haven't heard anybody mention anything about keeping any of them in place. Is that been spoken to? Has anybody talked to South Central about keeping the sanitarians we have now, the staff that we have now? Or are you going to be letting everybody go and getting people in from another district that don't know this town, that don't know the soils around town, that don't know where sewers really need to be?
I think it's probably worth mentioning that the current
of knowledge in Chesapeake that you have had for years, and it's not worth losing.
I think I would just reinforce something I presented at the beginning of the meeting, that the director and 4 other staff at South Central are extremely familiar with the town of Cheshire. The director in South Central was the chief sanitarian and did, I'm sure, and Maura can attest, many septic permits and other environmental permits for years here and is very familiar with the town of Cheshire. So I just don't want to leave people with the...
I just want to make clarification that Susan was our chief sanitarian. She was not our deputy. I don't have a deputy. Susan got her registered sanitarian license in 2015 versus mine in 1993. So I've got 30 years of experience.
Okay, I was just addressing the comment that the folks at South Central are unfamiliar with Cheshire, and I think the truth is the opposite, which is a number of folks that are there in South Central now were with the Chesapeake Health District, and that is a factual statement.
I would just like to add my 2 cents that I think you're being penny wise and pound foolish over this. Thank you.
Robert Cotto again. Something I don't understand. We hear a lot from all these MRC volunteers. When this move or if this move takes place, do we lose all those volunteers? Do you guys stop volunteering for the town of Cheshire? Can you keep your volunteering. There was a gentleman, it made it sound like if this move takes place, we lose all those volunteers. So I just like that clarified from you. Do they go away? Do they just stop volunteering, or we have to find new ones?
Well, I probably can speak for everyone up here. I can't imagine we wouldn't want the resources of local volunteers. I just can't. I mean, why would we want to lose volunteers? Now, if some choose to no longer volunteer for any variety of reasons, that's out of our control. But it certainly would not be my hope and maybe expectation. But again, that's the best answer I can.
I didn't know if they were just tied with the district and you lose them.
No, I think their training was spoken to, that it may be more complicated for some members. I heard that statement made by someone today. But the resources are there in that 41 town MRC district. Correct me if I'm wrong, Sean. I believe that's what you stated. For
That's
any
correct.
training and whatever.
And I should also clarify that the expectation, because we did have that conversation also with South Central, is that training for Cheshire Capital Region volunteers, should they wish to participate, could also be held locally. So that I know that concern was raised earlier, that the only trainings afforded would be many miles away. And I was reassured that that's not the case.
So unless they personally stop volunteering, it'd be
Right.
the same. We wouldn't lose any of that resource.
I would certainly hope not.
Good. Thank you.
I mean, nothing in the move would dictate that occur.
Hi, I'm Robin Emmon, 2060 Waterbury Road. First, I'd like to thank you all for doing your work. Our town manager, you know, I really wish you all would look at what he's been doing for us. It's a great thing to have our town manager sitting on a board watching what's happening for our town. This is a good thing. It's not a bad thing. You know, he's watching where our money's being spent, how the process is working or not working. I have a hard time having him attacked over doing his job. He's doing a good job. We take permits for additions and stuff. So we deal with Chesprocott, Southington Health District, Plainville Health District. All of them are great to deal with. Our permits go through easy, inspections are quick, no problems with any of them. So I don't see a problem switching from one to another. And I don't think it's, you know, picking on Maura by changing. Maybe Southington Health District hires her, or the South Central Health District. Maybe they hire, you know, some of you that are volunteering. You know, that's why they need the time from now until next year to get their staff up. It's not, you know, doesn't mean you're not going to have a job. Doesn't mean that you guys can't
Ms. Siemens,
volunteer and help
Ms.
our
Siemens,
town. You know, you can all
Ms.
still.
Siemens, I think if you could keep the conversation through here, it's probably,
I
it's
understand. I'm
definitely,
just
it's a
saying,
better
everybody-
highway.
The scare tactics and the, oh, you know, this person's going to lose their job. It's about our town. It's about what's doing right for our town. It's not about anybody personally. It's what's doing right. So I don't have a problem switching to Southington. They're really good to deal with, honestly. We've done it. We've been doing it for years. Plainville also. So that's all I have to say. Thank you.
Thank you.
Good evening, all. Faith Ham, 633 Cortlandt Circle. I would like to echo others' sentiments that I do hope that the volunteers connected with Chesprocott continue to volunteer for Cheshire. I have heard, forgive me, I'm not entirely familiar with all of the services that Chesprocott provides. So if I'm asking a silly question, forgive me. But it sounds like there's an awful lot of opportunity to digitize records that would save realtors and others a lot of trips to the office. Where do we stand on that? Sewer records, perk tests, all of that. Are those records digitized? Yes. Okay, thank you. So a realtor could access those from the office. Okay, thank you. And then second question, Will Cheshire hold one or more seats on the SCHD without any resistance or pushback from current management on the board?
The board seats are dictated by state statute, and so they're apportioned by population.
So you will have, Sean, you will be able to get on that board without any resistance or
Well,
problems?
it's the decision. The Cheshire Town Council makes the selection of the 3 board seats, and it's the same as it is in Chesprocott as it would be in South Central.
Okay, very good. Thanks.
Good evening. My name is Jackie Trusty. I'm 316 Sir Walter Drive in Cheshire. I didn't mean to speak tonight, but one thing I have witnessed, which is concerning, is that you've had discussions with this other health centre, but you haven't had discussions with Chester Pot. I think that that is an issue. And I think that if you honestly think that you're going to get the same value for much less, you're in La La Land. That is not going to happen. It is just not going to happen. It's just not. I'm sorry, it's not. That's all I want to say. And except to say, I think you should hold the vote off. I really think you should hold the vote off. If you look at the people here who are against this move, you need to listen to your citizens. You have to listen to your citizens because they're clearly unhappy with this sudden change. Thank you.
Thank you. Okay, it looks like we're at the final run here. So what I'm going to do is I'm going to adjourn this special hearing, public hearing, I should say. And we'll do that with the gavel so you all hear it officially. And we will now move along to our second public hearing for this evening, which is the Town Council public hearing at 7, well, we're well past 7, council chambers to consider the Town of Cheshire joining South Central Health District effective July 1, 2024. Noel, could you read the call?
The Town Council of the Town of Cheshire will hold a public hearing at 7 p.m. on Tuesday, October 10th, 2023 in the Town Hall Council Chambers, 84 South Main Street, Cheshire, Connecticut, on the consideration of the Town of Cheshire joining the South Central Health District effective July 1st, 2024. Electors and citizens will be heard at the public hearing concerning this matter dated at Cheshire, Connecticut, this 28th day of September 2023.
Thank you for that. We're not going to do the presentation as I had previously mentioned, unless there's a whole lot of people that want to rerun, but we're not going to do it anyway. So if you all recall what was stated, but still remain with questions, because it is a separate issue and a separate public hearing. If there's any specific questions or comments that you'd like to make on this particular action that will be considered later tonight, now would be your time to come forward. You know, if you'd come to the mic, I'd be better served. Excuse me?
She didn't understand what you just said.
Oh, okay. What I just said, I'll repeat. If anyone in the audience has a question specific to joining the South Central District, now is the time to ask a question or make a comment if you'd like to. Now, many of those comments have probably been made prior to this, but I'm not foreclosing on anyone asking a question or making a comment on this other action that will be taken. So. You got to go to the mic.
She wants to vote.
No, we're not voting now.
This is a public hearing, so we don't vote in public hearing.
Oh, okay. I was going to wonder.
No. This was strictly a matter of the fact that we must have a public hearing before action is taken by the council.
Would there be an opportunity for another public hearing for people, or is this the only one on this issue? Would there be another public hearing perhaps because of the interest in the topic? Would you consider having another one?
No, I
just
wouldn't
wondered.
anticipate another public hearing.
Okay.
No. Anyone With a question or comment? Mr. Bowman?
Good evening, Paul Bowman, 387 Mount Sanford Road in Cheshire. I have a few comments. I've been working with Chespercott for almost 40 years professionally. I'm in the building and development business. And what I hear and see is compelling information for you to strongly consider what you're going to vote on. I'm not here to, excuse me. Oh, I'm not here to criticize any people whatsoever. I'm a frequent customer of Chespercott and have been for many years. And my experiences have been generally okay. During the COVID period, it was very difficult. Our business model is to be as efficient as we can, to acquire costs for services as inexpensively as we can. And that's what's critically important to my business and probably a lot of contractors in the town of Cheshire. I don't believe the fees that we pay for engineering services from Chespercott with perk tests, strata tests, and other types of services are included in the overage that you show for the savings that you're projecting. So our fees are above and beyond that. And while we're always looking for reasonable fees, we understand we need a good service. And that's what's critical to us. So I just want to say that I think you need to really consider this from a business perspective. There's not many people that were willing to come up here. There's another contractor, I guess, that spoke earlier, and he had nothing but a positive experience with Chespercott. I've had both positive and negative experiences from a business perspective. As far as the personalities, we need to take those out completely, but I will say that I've been always treated with dignity and respect from Chespercott. So that's not the issue whatsoever. But I do think it's important that you as an elected body need to really look at this from the entire town, not just the public health that's provided by Chespercott, because there's restaurants and delis that are way behind in their services. They're supposed to be inspected. I'm not sure. I don't believe they're being inspected as they should be. And that's a concern for health too. I've heard a lot of focus on COVID. I've heard a lot of focus on public health, which I understand. It's critically important. But there are other services that I think need to be taken into consideration. Thank you.
Thank you. Would anyone else like to come forward? Okay, seeing no one that wants to come forward again, I will close this public hearing. Thank you all who made your comments and suggestions. I do appreciate your input sincerely, as does the council. I'm confident I can speak for them on that. So with that, I'm going to move along to our regular agenda tonight, which, because I've been shuffling paper for a while and listening at the same time, and I'm 68 years old, I'm going to take a minute to grab my agenda. Oh, one of my colleagues has asked for a 5-minute recess. So I think it's reasonable and fine. Good opportunity for people to get comfort. Yeah, that's fine. That's very good. So with that, we're just going to have a 5-minute recess. I wanted to go home too. Um, But we're back here for the important part of the meeting, which is taking the wallet out of my back pocket. So, once again, I welcome you to the Town Council special meeting of Tuesday, October 10. It's a regular meeting we normally would have, and we're about 9:15. There's a handful of things we do, but we will dispense with the roll because everyone is still present. We will dispense from the pledge since we've already done that and continue to do so. And we begin with public communications, and we do tonight have a proclamation for the Cheshire Food Drive. So I will read the proclamation, and I believe we have, Selena, we have the director in concert. Marlena, would you like to join me up here and we'll just read it and, do the tap dance we do at these times? Thank you, thank you, thank you. Okay, here goes. This is a proclamation for the Cheshire Food Drive 50th anniversary. Dated, well, it will be November 4 to 5, 2023. Whereas the Cheshire Food Drive is celebrating its 50th annual wide food drive on November 4 and 5, 2023. And whereas the food drive serves a vital function by supplying food for our hungry neighbors and funding the town of Cheshire's food voucher program. And whereas the Cheshire Food Drive depends on the hard work of dedicated volunteers and the generous donations from local residents, business, and organizations to continue to meet the increasing need of this assistance. Now, therefore, I, Tim Slocum, Mayor and Chairman of the Town Council, on behalf of the Town Council and all the citizens of Cheshire, do hereby congratulate the food drive for its 50th anniversary and recognize the volunteers who make this annual food drive such a success. We thank all of our citizens who contribute so generously and assure that this vital community program is sustained. Dated this 10th day of October.
Thank you very much.
Please say a few words. We love having you.
I will. I will be brief. It's about 45 minutes with a slide, but that's no, first, I did want to thank on behalf of the Board of Directors of Cheshire Food Drive, Inc., I do want to thank the Town Council for acknowledging our 50 years of an annual food drive. We also take this opportunity to invite all of the Town Council, everybody here, everybody at home, every Cheshire resident, every Cheshire business, to please join us the weekend of November 4th and 5th. We will be on the First Congregational Church Green from 9 to 3 each day, Saturday and Sunday, as well as in front of Stop and Shop. We will have volunteers collecting both food donations and monetary donations. Our food donations go to fill area food pantries, including, of course, the Cheshire Community Food Pantry. Our money, however, goes to fund Cheshire's food voucher program. This is a super secret program that is open to every Cheshire resident and has been since the mid-1980s. Basically, a food voucher, if you or your family or someone you know lives in Cheshire and they're just having a bad month, we strongly encourage you to contact Cheshire Human Services, and you can get a $40 or $60 voucher. You take it to Stop and Shop or Big Y. You pick out any food or personal care item that you want. The grocery stores then send Cheshire Food Drive, Inc. the bill. Since 2020, we have distributed over $100,000 in food assistance, and all of that money comes from people like you. Lastly, if you have any questions about the food voucher program, if you have any questions about the food drive, you want to volunteer on the green, if you own a business and you want to have a food drive in your home, in your neighborhood, in your business, please contact www.cheshirefooddrive.org. We're happy to answer all your questions, and we really appreciate the community commitment that we've had. And for 50 years, we've all been helping to feed our neighbors. Thank you again.
Thank you so much for that. And obviously, I'm sure I can echo the praise from the council for the great work your volunteers do. It benefits all of us in town, keeps people busy doing important work, and we need volunteers like crazy. We don't have enough volunteers for much of anything these days. But thankfully, Cheshire has a lot. So with that, we're going to move along to the quarterly consent calendar donations. We do this every quarter, and we acknowledge donations that the town has received, usually from just generous citizens from our town. And in this particular case, we're acknowledging the receipt of $1,060.65. Thank you, citizens, for that. We next move to public comments. I know specifically the veterans are here. And if anyone has a comment to make after them on a different topic, I would welcome that. But I would like to first acknowledge the veterans who have been patiently here. Most of us were greeted by a lot of flags flying, and we appreciate that too. It's quite an interesting gallery to go through a gauntlet of flags with wonderful veterans. And I thank you for all of that. So whoever wants to speak up on that, I would welcome that. And if there isn't anybody right yet, I would like to offer something, because I don't want to state that I know what you're talking about, but by the same token, we all know what you're talking about. So if I may, with your permission, veterans, I would like to state what we would like to do as a council, and I will have to put this on my plate because it hasn't been put to the council. They're hearing it tonight. But we are going to form a Veterans Memorial Committee to identify appropriate locations for veterans memorials, which the council can approve. The MIA POW flag will be eligible to be flown at these memorial locations. Should the town seek state funding for the memorials, we will take the committee's recommendation to the Commissioner of Veterans Affairs for approval. I know I had spoken to both Mr. Fox earlier, and I had stated it slightly differently, but we did gain some better clarity from speaking to the Commissioner of Veterans Affairs office. And they did indicate that should you recommend 2 or 3 sites where a MIA flag had flown, and no state funds are used, the town can make an appropriate vote on your recommendations. So after the formation of this committee, we would expect their charge to be, among other things, a larger project that's being contemplated for Bartlam Park, which there's been some discussions on, as I know already, and at least the 2 spots where flags had flown on town property. And again, your recommendations could be, I suppose, anything. And those would be subject to council approval. So with that, I will be forwarding this to the Ordinance Review Committee for their review, and would anticipate action by the full council soon thereafter. And I must state there is process, and the reason it's going to Ordinance Review is they're the body, the 3-member body of the council that handled the flag policy in general before it was put before the council and made a policy. So with that, I just wanted to state that, and certainly if there's anybody who would like to speak on behalf of why you showed up in the first place, I sort of said it all, that's why you showed up, and that's maybe not fair, but there is a line, so whoever wants to speak first regarding that, I welcome it.
My name is Gail Whitwright. I'm from Cheshire and a teacher. My mom founded the Jack and Jill Nursery School in 1954. And I have a foundation, Proposition USA, .com. The goal is to bring our country back and help our veterans. Every day, 22 veterans commit suicide. And it can be just simply calling them up and saying, going grocery shopping, what do you need? Or just, we're having a barbecue. Children need to learn about respect for our history and its veterans. They have to know about Pearl Harbor, Iwo Jima, Battle of the Bulge, and Korea in 1776. Without our veterans, we have nothing. I'm a proud member of the Daughters of the American Revolution. My father, Joseph Whitwright, was a manufacturer, and his father, Samuel Whitwright, was a dentist in Waterbury, and his father, Michael, was a pioneer, and his brother, George Whitwright, were members of the Pennsylvania militia, and they were the first United States Marines. Any Marines here? Thank you. Find out what they are teaching your children, and we need Mother Goose in this country, not Mother Jones. Thank you.
Thank you.
Hi, my name's Vernon Gregory. I'm actually from Indiana. I came here in support of the other veterans. I live at 3145 West 53rd Avenue, Maryville, Indiana. Well, anyways,
welcome.
Thank you. Thank you. Yeah, it's a great state. I have to say that. I love it here. Yeah, I come out here a few times a month. That was the one that just spoke was my editor of my book I wrote on Vietnam. But anyways, the POW MIA has a special place for me. I was in combat in Vietnam, 1971. In fact, that's when the POW MIA flag came into existence with Mrs. Michael Hoff. Her husband, a military officer, became missing in action. Well, anyways, on one mission I had in July of 71, two of my comrades were shot down. I was on the ground my first 3 months. My last 9 months, I was a door gunner on an observation helicopter. Well, they were over triple canopy jungle towards the end of the day, and they were shot down. Only one person could go down on the rescue mission. They were able to get the pilot out. The other two guys, it was starting to get low light, low on fuel. Wind was picking up. So the commanding officer called off the mission. We had to leave two behind. And that's very difficult because, they always say you never leave anybody behind. But triple canopy jungle, I was angry for 17 years. I went to counseling, and she explained to me if 6 of us went back to get them, we'd probably be there too. Well, in 2011, Randall Dalton, one of the guys, his remains were found, and he was brought back and got a burial in Collinsville, Illinois. The other one, Randall Gregory Antonio from California, his remains have not been found. And, I'm keeping track of that because they're still looking at times. So the POW MIA flag to combat veterans is extremely critical, important to us. Like I say, it's, if you've been in combat, you'd understand. And, it's something you can't explain to anybody. You'd never understand unless you're in combat. Thank you.
Thank you. Thank you very much.
Hi, my name is Howard Koenig, 538 Wood Hill in town. I had not planned on saying anything, but two things came to my mind, and I just want to say it publicly. Number one, I went in the Army in 1970. At that period of time, when you were on base, you wore your uniform. When you went off base, they told you not to wear your uniform. We were spit on. We were called baby killers and many things that were even much more vile. The sad story of the way the soldiers, the military was treated in the 70s, to me personally, was reprehensible and despicable. And it was everywhere. And when you were in the military and you changed your duty station, you had to leave the base in uniform and report to your new base in uniform. And so when you were there and you took the weekend leave, you put on your civvies, you went, nobody bought. People kind of noticed maybe the short hair, the shiny black shoes, but you didn't. There was so people would say, "Are you in the Army?" And if you said yes, you didn't know what to expect. The reason I'm bringing this up is the MIA and the POW flag have a meaning, a very special, very important meaning. And I personally would love to see the town really recognize so it's the ultimate sacrifice. I know people who did not come back. And, I went to my high school reunion and there was a list of people who didn't come back. So that is my thought pattern. I would like to see the town honor veterans. And the second thing I'm going to say to you, I am a member of the VFW and the American Legion. Every single meeting that we have in the VFW and the American Legion, there is the POW flag. And I'm bringing that up because there is no POW flag here. Okay?
Thank you.
Filantini, 111 Braemar Drive. I did prepare something, but first I want to just say thank you to all the veterans who are here. I really appreciate your fight, and I just want to make it known that I don't mean my being here any offense to you guys. And if you have any questions about why I'm here, I'd be happy to talk to you. And here I am. So good evening, everyone. Thank you for being here. My name is Filantini. I'm here to call for an amendment to the flag ordinance from this past July. I'm hoping that this ordinance will not only include the amendment for the POW MIA flag to be flown on town property, not just memorials, but also to allow for the Cheshire Youth Services Yellow House to fly the Progress Pride flag for the month of June, LGBTQIA+ Pride Month. This was proposed in an amendment back in July and failed 5-2. It was described by Republican council members as a carve-out and therefore unfair. If we're to discuss carve-outs, an amendment for any flag that anyone feels personally about could be a carve-out. I would not want that to be the fate of this POW MIA flag, and I want our troops to come home. I hope that that is the belief of everyone in this room. But I also want our students to come home, and that's what the Pride flag is about. Queer students are at a much higher risk of suicide than any other group, and any activist will tell you that. My flag and our flag is seen as political. This seems to be because my rights always end up on the ballot. But all of our rights are on the ballot. If we care about these local issues, we will vote in November for our council members who stand with us. We greeted everyone who came in the sliding door this evening, and I'm grateful that I was able to thank so many people for their support. We are no different than any other person in this room. I wish I hadn't a reason to argue that anymore. Please vote for an amendment that includes the Pride flag. Please give our queer youth hope and show them that this town is a safe space. This is about our people. Thank you so much.
Thank you.
Good evening, everybody.
Good evening.
Jeff Falk, 560 Mixville Road in Cheshire. I do appreciate I don't want to call it a motion, but what you put forward about the Veterans Committee, and love the idea. I look forward to seeing where it goes from here. It's time we had a Veterans Committee of some sorts in town, or Memorial Committee, whatever we're going to call it. Just so we can, we've always had a good relationship of working together with the town. And so one of my recent roles, I took over from John White as commander of the VFW post here in town. And my speech I prepared, some of it has questions. It's not questions for you to answer. It's just questions, stuff for you to ponder probably tomorrow, because I know you're not getting out of here at a decent time tonight. So, and I don't miss that at all. So in our family, in my family, you know, there are two types of people. We either serve or we support. My family service goes back to the Revolutionary War. Been there. My kids are supporting. My girlfriend's daughter is actually graduating boot camp right prior to Veterans Day. So is the American flag and a POW flag just a symbol, just a thing that has an abstract meaning? That flag along, you know, the POW flag along with the POW MIA flag, to me, is living and breathing. Those flags do not fly because the wind that blows it. It flies with the last breath of every soldier who dies defending it. Have you ever given some thought as to what a prisoner of war went through? I tried to. I read some books. Actually listened to Matt Bowman for a while. He spent some time with him. In the same sense, have you ever given some thought as to what the families of these prisoner of wars and missing in action service members went through? This is about service and sacrifice of those who raised their right hand and took an oath. An oath where they solemnly swear to support and defend the Constitution of the United States against all enemies, foreign and domestic, that they will bear true faith and allegiance to the same, and that they will obey the orders of the President of the United States and the orders of the officers appointed over them. Over 81,000 of those who took this very oath never returned home and are still considered missing in action. Their families, their friends, and comrades in arms suffer every day not knowing what happened to them, let alone not being able to give them a proper burial. By removing the POW MIA flag from flagpoles not designated as veterans memorials, what message are we sending to those families, to those friends, to those comrades in arms? As you walked in tonight, there was a sea of POW MIA flags. Most of them VFW members, a lot of them Vietnam veterans. Over 58,000 were killed in action, 612 from Connecticut and 2 from Cheshire. There's still 25 listed as missing in action from the Vietnam War from Connecticut. We do live in the greatest country in the world. We may have some problems. We may not always agree on everything. And I truly believe the alternative's not any better. Our future is our children, the youth of America. I don't think this is the example we want to be setting for them by taking down the flags and essentially forgetting those who have sacrificed everything so that we may live free. We have an obligation to never forget their sacrifice and keep their memory alive until they all come home. Designate these flagpoles as veterans memorials. I'd love to see all 31. We can start with a few. We can talk it over in the committee. We can move forward from there. This is the least you can do for the sacrifices and the sacrifices of their families so that they will never be forgotten. And if you want to see some stuff on our local Vietnam War veterans, my daughter worked together with Bizzuto's Media last year when the wall came and produced the videos. It's on her website, bcofthebrave.org. Look at your neighbors, your fellow residents. And I did receive some correspondence actually from Doc Russo, who is a wall manager, and he would like to see the flags restored before he comes back up here. He thought this is one of the greatest spots he's ever been to in the years of doing that. And he said, whenever you want me to come back up, feel free. But I appreciate your time and thank you for moving this forward.
Thank you, Mr. Falk. Would there be anyone else who would like to speak to this?
Matt Bowman, 422 Maple Avenue. I had given Peter Talbot some handouts. I have been accused way too many times of trying to politicize this. And I will tell you again, I gave you a handout in July, probably threw it out, doesn't matter.
Nope.
It was a picture of me saluting two of our POWs. As I said before, I was part of a security detail that was stationed at Oak Knoll Naval Hospital in Oakland, California, to take care of them. It just happens that in this month's American Legion magazine, there's a picture of a woman there. And I saw her many times visiting her husband. It was one of the men that I was saluting. Unfortunately, he has since passed away, but her story is incredible. Her story is that she and fellow women whose husbands were MIA or POW were constantly fighting the United States government, trying to find out what happened to their husbands. She threatened and then did go to the Paris peace talks and speak directly to the North Vietnamese, handing them 700 plus envelopes of correspondence to their husbands, hoping that they would get delivered. There's a whole story to it. I don't want to continue to go on with it. The process that has taken place here is wrong. You never went to a public hearing. You never brought this in front of the people. If you had, and the same result had happened, that the POW MIA flag was removed, I wouldn't like it, but I could understand it. What you've done with your backroom politics is wrong. And now you're going to try to placate us by saying, we're going to let the flag fly and we're going to get a committee. You want to do something? Start a committee. You'll never get done. It was wrong of what you've done. Your process is wrong. Going back into that caucus room and deciding for the people of the town of Cheshire what they need and what they don't need is wrong. It's despicable and it's embarrassing. And I just hope that we come forward with the right result and that flag is returned where it belongs. Thank you.
Thank you, Mr. Bowman. So,
Good evening, Don Falk, 23 South Pond Circle, Cheshire. I've mentioned this in the past, but today is October. I have this particular one I didn't, but today, October 10th, Sergeant Garcia is coming back home to Laredo, Texas. He was missing in action for 73 years. He's been identified. His family is happy to have him back to bury him. One other thing that's in the news these days, you're going to see a lot more about POWs and MIAs. It's Israel. It's Hamas. You know, you can see now what these families are going through. Don't forget what the 81,000 others, and those especially that we think of Vietnam, those families are waiting all these years. But if you listen at all of the news, you get a sense of what this means about POWs and MIAs. Thank you.
Hi, Stanley Emmon, 2060 Waterbury Road. Sitting behind me in the front row during the first part of this meeting was a neighbor of mine that's a Vietnam vet. He's very upset with what's going on. I can't speak in his behalf. He had to leave. The only reason he was able to get up here is because you have an elevator. He couldn't sit any longer waiting. But I want to say on my own behalf, my father was a World War II vet. He enlisted at 16. The only two flags that should be flown is the American flag and the POW. Thank you.
Thank you, Mr. Eamon. Anyone else? Sure.
The PL, well, you know who I am. I gave it before. You need it again? Okay, Vernon Gregory, 3145 West 53rd Avenue, Maryville, Indiana. The POW MIA flag is the only flag that can be flown with the stars and stripes at the White House. Keep that in mind. That came about in 1986. So that's something to keep in mind. I am a lifetime member of the DAV, VFW, and VVA, Vietnam Veterans of America. And, the other thing too, you take, it's only like 6% of the entire population serves in the military. Out of that 6%, I think only half of a 1% actually go into combat. All the rest are support, supply, cooks, whatever it takes to for combat. So it's not a very large portion of what keeps everybody in this United States safe. So I just, like I say, I'm here for support for what's going on, and really need to seriously consider our feelings. We went there for you. That's what we went there for. Everybody. We went there for everybody to make sure you were free. Thank you.
Thank you.
Hi, Robin Emmon, 2060 Waterbury Road. I have a question. Do any of you remember what year it was that we had the Welcome Home Vietnam Veterans here in Cheshire? Had to be 2012, 2013. It was a huge celebration at the Cheshire High School. None of you remember that. It was massive. More people
remember
than
the
I
wall.
ever.
I know, Robin, we had the wall here twice. It may have been around that time. I just don't remember.
It had to be 2012, 2010, 2012. It was huge. And I was so proud of our town to actually do that, to welcome home our Vietnam veterans, because they got crapped on by so many of our people. And now I'm embarrassed by my town for taking down that POW MIA flag. 82,000 people missing, prisoners, and we take down that flag. We should be embarrassed. We really should. I'd like to see that flag back up on our town hall. There's federal code. Why aren't we following federal code?
Well,
Federal code doesn't make us do something, but we should be following that federal code.
Well, to be clear, there is a memorial outside that has that flag hanging and displayed.
It's not on our pole where it was, correct?
No, it's a set. It's
There's two sets of flagpoles, one here and one there.
yeah. The memorial's right here.
It's
It's a town hall. There's also one hanging from the flag at Cheshire High School, and then the third one is flying at
The Medal of Honor.
Medal of Honor down in Bartland Park.
But we had them all over town, correct?
There was two others that were flying.
Yes. And where?
One at Public Works and one at the police department.
And why was it taken down?
Those were not designated veterans sites.
There's nothing in federal law that says it has to be.
Well, that was what we followed. Now, that doesn't mean, I've suggested there's a way to change that, and we'll be offering that to the council to consider and make a decision
What's
on.
there to consider?
Well, you have to have a vote.
Respecting our veterans.
We do respect your veterans, our veterans. My dad too was a veteran. Thankfully, he did come home, but he served in combat on Tinian. Well, he mostly dropped stuff from Tinian. But, you know, there's veterans in my life, everyone's life up here probably somehow. The town, I think, has done a wonderful celebration of its veterans. I think,
Well,
you know,
voted to
while
take
there
it-
may be
you
a,
voted to take them down.
well, we didn't vote to take them down. We created a flag policy that people that have issues with certainly wanted to include that flag, but it was dedicated to where there were memorials. And so there was no such designation at those two other locations. They were hanging, probably at the request of veterans that were employed by the police and public works. Obviously, there's veterans in those organizations, probably more than in most others in town. So I think I know we want to address this. And we've made that, I've at least spoken on behalf of the council, my desire to be able to address that through a policy change. And it would require a vote of the council. I can't do anything by fiat, thank God. It's not right.
Right.
And we know that.
Why do we need a committee? You're all sitting right there.
No, here's the thing.
Take a vote.
We get to take a vote, but we're not going to go and decide where the memorials are. It's best to put this in the hand of a memorial committee, which would largely consist, of my thinking, of veterans and or people associated with that, which hopefully, should they disband, it becomes the future veterans organization in town. I mean, there are things that could help the whole organization over time that could come about from this. So I don't think it's a
quickly-
hollow gesture. I think it's an
How quickly are
important
you going to
gesture.
do it?
Well, I'm referring it tonight officially when we get to the referral section of our agenda to the Ordinance Review Committee, because that's where this started. You know, I'm sorry, there is process to follow by town charter, something, our constitution, so to speak. And from there, it would be moved to the committee, to the council. And it was my suggestion that could probably be accomplished in a Zoom meeting. That's a committee of three, a referral made probably the same night. Then a committee does have to be populated. But it, in my estimation, could come before the council probably by a special meeting if need be, perhaps by Zoom. I just have to find out, as does the committee, if in fact we have to advertise for that memorial committee, that it has to be populated with 5 or 7. I don't think necessarily that it does, but I think it does have to consist of veterans, of course. And
As it should.
but the other component of their charge would be what's already sort of being undertaken now, and that's a fairly expansive memorial being contemplated for Bartland Park South. There's been an architect who's offered his services. I think they've only had a meeting or two, but it's early on in the process, but they have to get going on it, of course. So I believe that it's better to have a charge for that sort of thing, and hopefully my colleagues agree. That could also be broadened to include other sites they may investigate and refer to the town council for their approval. The larger one, to be down at Bartlam, will require Veterans Council approval. And that's the state organization that actually gives it its blessing. It's not a council action. So that's sort of the process that I'm recommending for the council. And, I'll take my lumps and bruises on the criticism that are coming at us. I think that's reasonable and acceptable for really anything. But I believe when I make this referral tonight, you will see action.
Okay. Thank you.
Thank you.
Hi, Leslie Marinero, 14 Winged Foot Court in Cheshire. I'm a vice president of the Army Air Force Roundtable here in Connecticut that meets here in Cheshire. Also a member of the Cheshire Veterans Council and the Town Memorial Parade, and also involved with the new Veterans Park that we're looking at in South Bartlett. So thank you for bringing this to everyone's, to public forum. And thank all the veterans that are here for your service. I just want to say, listen, I'm very proud of being in this town for how you all respect our veterans. I don't think there's many things that any of the veteran groups need that we don't feel that we have open access to the town manager, the town council, and to the people in town that this is important to. As far as a POW MIA flag, I don't think Jeff very well said about the reasons why that's important. That flag has a meaning. I am not a veteran. I just support veterans. My dad was a vet, and I also was brought up to honor and respect our veterans. That's why I do what I do in town. And I got off planning and zoning to help our veterans in town. That POW MIA flag means so much more than just being, it's not that any of the other special interest groups, I know what you're up against. You say yes to one, you've got a lot of other flags you've got to deal with. My father would want the Italian flag. My mother would want the Irish and the Spanish flag there. Where do you draw the line? I get that. The POW MIA flag, though, I think transcends that. That is about all the veterans that have not come home, whether they were killed, missing in action, or a prisoner of war. And I think that needs to be something that's looked a little bit beyond the average requests for flags for various months, National Cookie Month, and they want their flag up there. I get it. But that POW MIA flag has always very proudly flown in this town in both of those sites. I thank you for letting it be expanded. If we've got to call every pole that we want in town a Cheshire Veterans Memorial to put that flag up, so be it. If that's the way we've got to get around it, but just please consider that the MIA POW flag is a very important flag to have up, which is why what the woman just said about the flag, being on federal on properties that with the American flag. It's very important. It transcends beyond the monthly activity, and it's very important to our veterans. And I hope that the town council looks at that, because I know you do support our veterans in town, and it's something that our town should be very proud of. That's all I want to say.
Thank you.
Good evening. Amy Borden, 35 Paroline in Cheshire. I just wanted to say that both my grandparents, grandfathers were veterans, Army and Navy. My father served in the Army. My brother retired a captain in the Marine Corps. My uncle retired a lieutenant colonel in the Marine Corps. I have several cousins now in the Navy and in the Coast Guard. I come from a family richly rooted in military background. I don't think that whoever removed these flags without doing a little bit more due diligence to the community quite understands the implications that it's had for our veterans. And I don't think that at the expense of a group that's seeking some sort of a commitment from the town council to be able to fly their flag, we should be trading it in for another flag. So I guess my question just to start would be, how were we allowed to have the POW MIA flag for so long until it was taken down? What precipitated that?
We didn't have a policy on flags on town property, for starters. there were those flags in the dedicated memorials, probably because they had benefited from some state funding, had commission approval from the Veterans Authority up in Hartford. And then the others were probably at the request of the Director of Public Works and the police chief at the time, just hung the flag there. Those were the two locations they were removed from. So
were they
were not,
instructed to remove them?
well, the town policy created a situation where they had to. So there's an attempt here to make a correction here. But you know, there's 31 flagpoles in Cheshire. And I couldn't tell you where they all are. There's 31 flagpoles. There's never been, 31 MIA flags hanging there. I'm not certain that I would advocate for that either. I'm not suggesting that we don't let this committee, which committees do matter. They can focus on things in a way, do their due diligence, make some recommendations, and we sort of take it from there. And we stay within the policy that the council voted. It was not a unanimous vote of the council, and 2 members were not present, but a majority of the council voted for the policy. And it was based on some of the stuff that had taken place up in the city of Boston, which resulted in a Supreme Court ruling stating that, anyone wants to fly their flag, it's got to be you can't exclude one. We decided we didn't want to get into a free-for-all. For me, it's the red, white, and blue. We have a state we live in, and we got the town seal. So that for me personally says it all and does it all and takes controversy away. Obviously, we included the flag, the MIA flag, where we had the memorials, because that conformed to the policy that we had adopted or was recommended and adopted. So that explains how it happened. It didn't happen in a vacuum. May surprise people that it happened. I'm not suggesting it didn't. We didn't hold a public hearing, but all our meetings are open to the public. No one comes to our meetings. Our meetings are on YouTube. We don't get 2 people coming to their budget adoption and all the hearings that we spend hours, 20 meetings on, probably more. I'm not condemning the public for not showing up, but you can end up with tyranny when people don't show up. And I know that just as you do. And we could get there that way. So I love this. This is fine, but it should happen all the time.
I guess I'd leave you with this comment. So Rob and Edmund mentioned that there's the research I did, there's approximately 82,000 POW MIAs. They're still recovering.
Yeah.
I believe in the range of 30,000 are recoverable. Missing in action or prisoner of war doesn't necessarily mean that you're dead.
Right.
So moving that flag to a memorial, I think, is inappropriate. It's okay because it belongs there, but it also belongs on the flagpole in front of town hall. It belongs on the flagpole at the post office, which is
We don't have any
following
control over
federal.
what they do.
No, I'm trying to echo the sentiment
Sure.
of everyone here when I
Understood.
say that even the federal government, under all the different political parties that have been in power, have recognized this flag to be an important part of freedom, of recognizing that there's still people that haven't come home, and the American flag covers everybody. So when everyone starts talking about this flag and that flag and my flag and your flag, the American flag covers everybody.
Amen.
So I just think that I'll leave you with this for the committee that it has been formed or is in the process of being formed, that we do have to be sensitive to the people that are missing in action and prisoners of war that are not dead. And so they belong on a living flagpole, not one in a memorial. Maybe some of our schools deserve to have it because children need to be educated about what's going on. We see what's happening in Israel. Women and children are being dragged out of their cars by their hair and tortured and being used as human shields. Just as many of our men and women that have gone to fight for us and never came home, and we can't account for them. We don't know if they're dead or alive. So I just think everyone should keep that in mind when you're forming your committee. And that flag deserves to fly on more than 1 or 2 or 3 flagpoles in this town.
Needs to be said is that the idea of a flag policy came about because of a number of cases that were decided across the United States over the last 7 or 8 years, culminating in a 2022 United States Supreme Court decision in a case called Shurtleff that involved a decision as to what flag could fly on a City of Boston flagpole. And the issue that has been litigated and that has come to the forefront over the last 7 or 8 years is the fact, and this is not anything new, that a flag on public property constitutes government speech. And the case law that has emerged has consistently held that if you don't have a flag policy and you make a la carte content-based determinations as to which flag you're going to fly and which flag you're not going to fly, you're engaging in unconstitutional discrimination. So the recommendation that I made was to adopt a flag policy. We patterned the flag policy off of the state of Connecticut's flag policy, which was written by the state Capitol Police. I think it was in 2010. So other towns around Connecticut, other cities and towns have been facing the same issue. If you don't have a flag policy and you're put in a position of saying yes or no, you're either going to have to say yes to everybody or you're going to have to say no to everybody. And we live in a time where there are many different types of divisive groups that wish to have flags flown for various reasons that many people would never want to see flying on a flagpole. So the idea of having a flag policy in place is to protect the town from litigation and exposure to claims by folks that they say no to. Because if they're going to say yes to anybody and they're going to say no to others, then we're going to have constitutional litigation. So the idea behind the flag policy was exactly that. And the flag policy itself was patterned after the state of Connecticut's flag policy. So certainly there was no intent to disrespect veterans in any way, shape, or form. And the reason for the process that the chairman described tonight in terms of having a committee and identifying veterans memorials is because that's what the Connecticut general statutes require. In order to have a veterans memorial, if it's going to be funded in whole or in part by the state of Connecticut, you have to have a process that involves ultimate approval by the Commissioner of Veterans Affairs. And if it's not going to be in a shape or form by the state of Connecticut, then a separate statute, 27-124, allows the municipality to appropriate funds and have a committee to identify where the memorials are going to be established. So there is a process. This process was discussed in detail at ordinance committee meetings because even though it was a policy, it was referred to the ordinance committee. We had at least 3 meetings, public meetings, at which this was discussed several months back. So if you want to blame anybody for what the ultimate product is, blame me, because I wrote a policy that I know will not get the town in any trouble from a liability perspective. And that's my job as the town attorney, to write a policy. I don't have to agree with what the Supreme Court or the United States Courts of Appeals or district courts say is unconstitutional restraint on speech due to content-based regulation. I just have to follow the law, okay? And so I wrote a policy that is constitutionally valid. If we need to make modifications because 2 flags were taken down and we want to have those sites designated as memorials so those flags can be put back up, fine, we can modify the policy to accomplish that. But that's the whole story behind the policy. I think it's important for people to understand this wasn't some idea that the council came up with in a back room someplace. I told them, if you want to be protected, this is what we did. I represent a lot of towns. We're doing this in other towns. This is the best practice. This is what needs to be done. That's how we got here. Okay.
Thank you very much.
Jim Bolger, 61 Warren Street, Cheshire. I see a lot of double talk going on tonight on both subjects, and it seems to be everything is rushed. The decision about the flag was rushed because you were getting pressure from somewhere else, so you made a policy. You didn't bring it to open discussion like this, and maybe we wouldn't be here if we were. Secondly, for you to point at those flags and say that does it for me is not only ignorant, it's disrespectful to every veteran standing in this room now. That doesn't do it for us. Okay? I'm not done. I'm not done.
That's fine.
Okay?
Absolutely.
Thirdly, there's not one veteran in this room that doesn't feel guilt that they're here talking when 80,000 people are still missing. So it's more than about the flag. It's about the disrespect you guys have for rushing stuff through when you want to get it done quick, fast, and slick. That's not how it works, especially something this monumental. It's insulting and ignorant. And I'm angry and disappointed in each and every one of you for the way this was handled. This is not a rush job.
I would like to speak and only clarify one thing. When I pointed to those flags there, it was not to the exclusion of the MIA POW flags.
You specifically said.
Well, here's what the policy states.
Well, if you wanted to change the policy and you followed the policy, then maybe you should have brought it to a public hearing and let us speak before you adopted the policy. And none of us would have had to come here tonight and fight about this. And we could have made changes that fit his itinerary to keep us safe from litigation and everybody else. This was never against LGBTQ and I don't know the rest. I'm sorry. I'm ignorant when it comes to that. We weren't against that flag. We're against the removal of a flag that symbolizes the ultimate sacrifice.
And I recognize that.
Well, obviously a few weeks ago, we were rushed to judgment, and I'm glad, and I thank you for taking it back under consideration.
Well,
for a change, but we shouldn't have been here in the first place.
I think we would have been here in the first place. Could there have been a public hearing? There could have been. That's perhaps my mistake. None of this was intended to be done in secret. None of it happened in secret. We have public meetings, which nobody comes to, and that's fine.
I get it. I get all that.
We all know that. So I hope that well, first of all, I was speaking to those flags because those are the flags that could be hung on any pole in Cheshire.
I understand.
That the town owns.
I understand.
The MIA flag could be flown on memorials, veterans memorials. That was the policy. And the town attorney spoke rather succinctly, I thought, to that issue.
I don't have a disagreement with anything the town attorney said. In this world, in this litigious world we live in,
that's
and
why
exclusion and free speech and everything else, that's great. But we could have dug a little deeper and not have been here right now if we just took the time. That's all I wanted to say. I thank you for your time.
Right. And I appreciate your comments, and I sincerely do. And if I'm hopelessly misunderstood because I pointed to 3 flags that I say it all, I didn't mean that to the
personal shot.
And
if it wasn't meant like that,
no, take my
then I
apology.
apologize.
Take my apology, because the last thing I want to do is, throw oil on water or whatever. I mean, it makes no sense to do that. I'm not here to personally insult a soul. And I don't believe our policy speaks to that either. But again, we've opened a door, just as was stated. We'd
Excellent.
like it to be,
Excellent.
answered. So
I don't
thank
have
you.
a problem with that.
Thank you
Thank
much.
you.
Appreciate your comments.
Again, I'm Brian Shane, 62 Hilltop Road.
Boy, you're out a long time tonight.
I worked with Jim Bolger at the prison for many years and lived at the condo. It is an emotional issue, but I have to say on a personal basis that I'm proud that you are studying this in such a serious manner and that you've established a committee to look into it even further. And I, for one, whatever you come up with, I think it's going to be the best thing. I have total confidence in all of you, and I'm very
Thank you.
impressed by all of this.
Thank you very much.
Thank you for that.
I'm getting out. I got to take my jacket off.
I just wanted to thank the town attorney for his explanation. I think I get it. I've seen it from Boston and other places of exactly what happens if you let this flag fly, that flag fly. So you can't let them all up. You got to turn them all down. I get that, and I appreciate his explanation, and I look forward to the committee. I'll be the first volunteer to be on your committee, Tim. Thank you.
Thank you very much, Mr. Falk.
I'd like to thank the town attorney for stating what he stated. And he can only advise you as to what you do. But you represent us, not him. He represents you. You represent us. And I do believe that a couple of members here wanted this to go to ordinance, and it was voted down. And it became a policy rather than an ordinance. And again, he can stand here and protect you. It was done in a back room. I'm going to read for you the exact numbers of the MIAs. Vietnam, 1,579. World War II, 72,208. Korea, 7,496. The Cold War, 126. And from the Gulf Wars, 5. So there's still people missing, even this recent. And it's still, Tim, your decision, and you're the chairman, and you're the one that made it possible to either go for a policy or go for an ordinance and let the people have their say, and you didn't.
And I don't recall that was any part of my decision process exclusively or even considerably. I believe we just went for a policy.
So I have a question. How do you decide which public concerns warrant a committee and careful consideration over a period of months and which ones
This one requires that.
get a committee?
This one requires that.
Oh, okay.
Okay, thank you. Okay. Are we almost done? Oh, Robin.
Can I ask the attorney a question?
Of course, absolutely.
So I'm reading one of our local towns here next door. Ooh, I just lost it. They have a flag ordinance, and it says the American flag, Connecticut flag, Southington flag, military flags to be flown on town property and inside schools. Does that not cover us? Can't we do that and be covered from a lawsuit?
Well, you don't need a policy to regulate what's flown inside of a school. Okay?
Okay.
The flag, the specific case law is that the flagpole, what you fly on that flagpole represents government speech. And what that means from a constitutional law perspective is that the government is adopting the message reflected by that flag. That's the problem, is that if you don't have a policy And I don't want to pick on anybody, but I'll just say Tea Party as an example. Okay. And somebody comes to you and says, I want you to fly this flag on your flagpole because you're flying, pick whatever group you want in your mind. Right.
Tea Party doesn't have a flag, but okay.
Oh yeah. Okay. So we want to fly this
know.
on, we want to fly this flag, right?
But okay.
You get the idea. It's considered government speech and you can't say yes and no. It's either yes or no. So you don't need anything for inside.
I'm saying our
inside a school.
military flags. This says military flags. It's not any other flags.
What town is
Our
that?
military. Southington.
Well, I do work for them, so I'm not going to comment on whether that's valid or not. I didn't write that ordinance. But I do work for them, so I'm not their town attorney, but
Not their town
I do
attorney.
work for them.
Well, obviously.
Okay.
But what's the definition of military? Just say United States Armed Forces? Okay, so can I fly an Iranian military flag? Can I fly an Iranian military flag? I don't think so. I think the Supreme Court would
Thank
agree
you
with
very
me.
much. Thank you very much. I'm going to now move on to our regular agenda. And this is where oh, I'm sorry, Rob.
There's other things.
1146 Wolf Hill Road. I don't know if this is town council or board of ed, but we had the proclamation for donations. Having a child in the school, we have, I don't know if it's school manager or something where we pay for meals. I think it'd be a good idea and take an advisement to add a little thing where you can donate for the kids that don't have meals or don't have the funds for that, so that I can also help them out when I make my payments. So I don't know if that's a Vinnie thing or a town council thing, but I think we should add something like that to that meal plan.
Well, I think they're the volunteers that do all that stuff. We were acknowledging their generosity and longtime commitment, correct? So,
Yes, I don't know if it's through them.
but
or
I
through
would,
Board of
I
Ed,
would
but I
think
it would be a
they
good
want
idea
to
add
accommodate
something like
that. Yeah, just talk to the group.
Okay.
Thank you, Rob. Okay, I'm going to move this along now to the approval of the minutes of September 19, 2023 Town Council Special Meeting, the minutes of the September 27, 2023 Town Council Special Meeting.
Second.
We have a motion, we have a second. All those in favor, discussion, I should say. All those in favor, signify. Motion carries unanimously. We now move to the consent calendar. Mr. Bowery.
Thank you, Mr. Chairman. Be it resolved that the town council approves resolution 101023-1, the consent calendar for October 10, 2023.
We have a motion, we have a second. All in favor? Motion carries unanimously. Okay, now we move from items removed from consent. There were none, so we move along to old business, which begins with the school building committee update. Brevity here is important, but anything that's important to hear is important to listen to.
All right, I'll be very brief. The Next Gen School Building Committee meeting, we had a meeting last on September 28th. Discussion included project labor agreements, and ultimately a vote was held to proceed with open bidding as opposed to project labor agreements for the projects. Meetings with the state have gone very well to date. There was also a presentation on life cycle costs for the MEP system, and also design discussions were held regarding the Norton School design. Sort of a summary of where things are. Otherwise, things are on track.
Terrific. Okay, we now move to the old business item of Bartlam Park South. We're here for an update on that.
Sure, I can do that as well. The project remains on schedule. The turf carpet is scheduled to be installed in the coming weeks. We had a meeting with the town council subcommittee and staff and our engineers on Friday. Dave Elder was in attendance. We discussed color selections for the bathroom facility, as well as reviewed and confirmed the design for the band shell. The provider of the band shell will be Cedar Forest product as opposed to Polygon. Well, it's the same product, but two different companies doing the construction because Polygon has been not responsive to our engineers through the process. But it will be the same product and the same design that we envisioned for the master plan there. So things remain on track, and other than that, happy to answer any questions.
Any questions? Okay. We're now going to move to new business. The first item of new business is the withdrawal from the Cheshire Health District. Mr. Walsh.
Thank you, Mr. Chair. Be it resolved that the town council approves resolution number 101023-2. Be it resolved that the town council hereby approves the town of Cheshire's withdrawal from the Cheshire Health District as of June 30th, 2024, and authorizes the town manager or his designee to execute all necessary documents for said withdrawal.
Thank you. Do I have a second, Mr. Velover? Thank you.
For the purposes of moving discussion, I will second that motion.
Uh,
No, now you have to make your motion.
Now, I would like.
Ms. Nichols?
Yes,
you wanna
I
make a
would.
motion?
Yes, I do. I would like, in the light of all of the information that we heard this evening, I would like to offer a motion to table this to the next or this following town council meeting, whichever fits the schedule.
Okay. So there's a motion to table. A vote on a motion to table requires a second. We have a second. Thank you. Thank you very much. So there's a motion to table, and that's a motion that has to be voted on first before we would vote on the regular motion. So all those in favor of.
Point of clarification, which is allowed. I know we can't debate, but
Thank you.
would you be expecting that if we have questions that we would forward them to you or the town manager?
Questions
That may have
specific to-
arisen from
I would, I
own-
think an appropriate conduit would be directly to the town manager's office.
Okay.
So I'd prefer to do that. But I'd encourage you to also copy members of council.
Okay.
I think that's a fair way to do it. And I will restate for the record on that, any communication that includes all our colleagues doesn't become a question about the question, a discussion on the question.
Right.
It's just a question.
Right.
I just want all subject members of the council to see what the questions are because they're fair. If that makes sense.
Mhm.
I'm going to call for a vote on the motion to table. All those in favor signify. Opposed? Motion carries. Okay. I'm going to eventually get it.
Oh, but it's yours.
It will be. It will be. Excuse me.
The next one then, or skip that?
Okay, we have the next item on the agenda, which is the approval of the town of Cheshire to join the South Central Health District. Mr. Walsh.
Okay, thank you, Mr. Chair. Be it resolved, the town council approves resolution number 101023-3. Be it resolved that the town council hereby approves the town of Cheshire joining the South Central Health District as the town's public health provider effective July 1, 2024, and authorizes the town manager or his designee to execute all necessary documents necessary to join said district.
Okay, we have a motion. I need a second. Thank you, Mr. Veliber. Okay, a motion to table, perhaps?
Well, yes.
Be considered?
Yes, is that the process?
Yes.
We had two
Table
public
this.
hearings. We
Right,
have two
okay,
motions. They
right.
both have to be
Okay, so
voted
I will
upon, one
continue
way or
the
the
tabling
other.
motion.
And I'll second that.
So we have a motion to table. Thank you very much. All those in favor of the motion to table? Thank you. Well, we had to take those two votes because there were two motions, so.
Yeah.
Thank you much. Okay. And thank you all who have prevailed through the meeting. Okay. We now move to the appointment of the Fair Rent Commission members. Mr. Mylone.
That the town council approves resolution number 101023-4. Resolution number 101023-4 pursuant to resolution number 031 031423. The town council established a fair rent commission. Be it further resolved that said fair rent commission shall be responsible for making studies and investigations, conducting hearings, and receiving complaints relative to excessive rental charges on housing accommodations, except those accommodations rented on a seasonal basis within the town of Cheshire in order to control and eliminate excessive rental charges on such accommodations and to carry out the provisions of CGS 7-148B to 7-148F, inclusive CGS 47 lowercase a-20 and subsection parentheses B of CGS 47 lowercase a-23 lowercase c, and be it further resolved that the following 5 residents have been interviewed and recommended by the selection committee and are hereby appointed to serve on the Fair Rent Commission for a term October 10th, 2023 through January 31st, 2026. Those individuals are Philip Bowman, who's a Republican, who would serve as a landlord, Krista Cohane, who's unaffiliated, who would serve as other category, Matt Kolauer, who's unaffiliated, who will serve as a landlord, Jessica Denard, who's unaffiliated, will serve as a realtor, and Matt Gates, who is a Democrat, who would serve as a tenant.
Second.
So we have a motion, we have a second. I want to thank whoever seconded.
Peter.
Peter, thank you, Peter. Discussion?
Before we go forward, I just wanted to say that we had, I appreciate the process where we set up an opportunity to invite people in who were interested. We got a number of people who were interested, came and interviewed. They were all very highly qualified and all very sincere in their interest to serve the town. It was hard to make a decision to select these individuals, but we had to select 5. And I think that as one person who served on this selection committee, we obtained 5 people who I think will be very thoughtful and balanced in their approach to serving on this new commission. So I'm very thankful with
Thank
that
you.
process.
And I do apologize, Mr. Mylone, for not having some discussion before the vote. That was terribly, that wasn't good of me.
Can I just say something?
Yeah, so I'm going to invite any comments that want to come forward, and everyone just has to vote again. No, I'm only kidding.
Thank you, Mr. I want to echo the same sentiments that my colleague said. Going through the process, there were a lot of different candidates, all coming from different backgrounds, and it did make it a kind of a difficult decision to do because, I mean, we don't like to tell people, no, you're not good enough, because they were all good enough to everybody who came in. But, you know, as John said, I think we have 5 good people. The biggest thing that I was concerned about is to make sure they all came in and had common sense about what they were doing. They're not there to set the rates for rentals in Cheshire. They're there to deal with any concerns or issues that may come up. And I think that's what these people will do. And I think, you know, we may not have any people coming before them, or we may have a few, who knows? But I think we're well set and ready to go with it. So thank you.
Anything, Peter? Okay. The only thing I would like to add is there will be an organizational meeting of that group where the town attorney will meet with them. They will have to elect a chairperson and really have a more fulsome understanding of what their obligations truly are. And then finally, everyone was asked the same questions during the interview of the 17 or 18 people. So there was a sort of a programmatic way to sort of think about the answers and grade them and come to a determination. So with that, no more votes, but that's the end of the talk on this one. So this takes us to the approval. No, excuse me. This takes us to D.
We haven't voted. We haven't voted yet.
Yeah, we didn't vote on it.
Why did I think we voted on that?
It's a late night. It's late. Right. We
It's
didn't.
10:30 at
Are
night.
they right, Noel?
They're right.
Oh, wow. Okay, maybe I should go home. Okay, okay. Well, then I didn't screw up. I take back my screw up. So all those in favor? Opposed? Motion carries unanimously. My apologies. Okay, now we go to D, which is the appropriation of $223,000 from the ARPA funding for the purchase and remediation of 422 North Brooksvale Road. That would be Mr. Bowery.
Thank you. Thank you, Mr. Chairman. Be it resolved that the town council approves resolution 101023-5. Be it resolved that the town council appropriates $223,000 from ARPA funding for the purchase and remediation of property at 422 North Brooksville Road. And be it further resolved that the town council accepts any and all payoffs which the town holds against this property. Second.
Okay, we have a motion, we have a second. What do we do next, guys?
Discussion?
Yeah.
Yeah.
Yeah, we discuss.
Due to the hour, I'll be brief, but the town attorney is owed a great deal of thanks. He was able to work with the guidance he gave us to give him with the range. We resolved and have the ability now for much more flexibility with the front entrance with Norton School. And I still hold out hope that we have the ability to cut off the property line. They did talk about this at their committee meeting, the school, and maybe sell that as a separate lot someday, because it will be able to be a conforming lot and take what we need for the schools. But be that as it may, there's $20,000 here over and above the great price the town attorney was able to win in the bid to fix up the property so that it'll be safe for people walking by and whatnot. So I think that I'll vote in favor of this.
And two, David, I believe if there's no other comments, town attorney can correct me if I'm wrong, but there are liens to be collected as well.
About a little over $25,000.
About 30,000.
30, yeah.
Yeah, we'll end up getting back the town's fees and costs and the foreclosure, plus the tax liens, the unsafe structure lien, and the zoning enforcement lien, plus statutory interest. So we get about 35,000 back in
Any
total.
property we have that's on that we could sell or auction off or whatever, right?
Yeah,
Yeah, there's some old windows.
yeah.
old
There's an
cars.
antique screw press on there that's I think worth some money.
Yeah.
Yeah.
So there are some things there, and this was the subject of great consternation on the community forum.
All right.
And there's always consternation there, and I accept that too. But, you know, the town, I do want to speak to one thing. The town has no right to go on somebody's property and decide that it should be fixed up. There is always a process. So to those who thought we should have gone in and cleaned it up, it was a good idea, but boy, you wouldn't want someone cleaning up your yard. And, you know, so there's a lot of stuff that goes into these sorts of conversations. But anyway, it's a process, and I think we're all ready to vote on it. So all those in favor? Opposed? Motion carries unanimously. Okay. Now we move to the approval of $22,000 allocation for the Peck Jones Fund for the enhancement of availability of quality reading materials. Ms. Nichols.
Thank you, Mr. Chair. Be it resolved that this is Resolution 101023-6. Be it resolved that in accordance with the Town Council Resolution 081412-10, the Town Council appropriates $22,000 from the Peck Jones funding to enhance the availability of quality reading materials in the classroom libraries for students in grades 2 and 3.
We have a motion. We need a second. Thank you, Mr. Veliber. And with that, we have.
Well, the explanation is, do you want to speak to that? The board.
He
Board of
waited a long
Education-
time.
Yeah, you want to do that? You've been sitting there.
For that reason, he's here for the next item.
Next,
Yeah, he's
okay,
here
I'll
for
do
the
this one.
next item.
The Board of Education, the Peck Jones Fund is a fund that has money strictly to be used for educational things. And the Board of Education is recommending to us that we approve this expenditure because some of the reading materials in those two grades have been well worn during the COVID times. Some of them maybe weren't totally returned in the best shape and they need refurbishing and they want to just upgrade that whole second, third grade learning character. And this is a perfect way to do it.
Well, thank you for that. Any questions before we call for a vote? Okay, all those in favor? Opposed? Motion carries unanimously. We now do move to F, which has a word I can't pronounce. It's the acceptance of a proposal from Inertia or Energia or Nausea for energy-saving performance owners representation services. Mr. Veliber?
Thank you, Mr. Chairman. Be it resolved, the Town Council approves Resolution 101023-7. Be it resolved, the Town Council approves the proposal from Energia for energy savings performance contract ESPC Owners Representation Services, and be it further resolved that the town council authorizes town manager Sean M. Kimball to execute this agreement pursuant to the terms and conditions as presented and the approval by the town attorney as to form and function.
Okay, we have a motion. We have a second. Thank you, Ms. Nichols. Discussion.
Yep, thank you, Mr. Chairman. There's a lot of information here. I could get Energia right, but I can't present representation. So I know you've got a lot of information on this, and you've been waiting all night to get up and talk to us. So thank you.
Thank you. Good evening, members of the council. Thank you for having me. I know the council members did receive a package that had a lot of material. So I'll start with a summary of what we're attempting to do this evening to get this approved, and then I'll be glad to answer any questions. At the end, if you look through everything, what we're really trying to do for our town and school buildings is make a determination if we can enter into an energy performance contract to make some infrastructure improvements that are in the capital budget and take the energy savings from some of the work that we do and have it help us pay for those improvements. This is very similar. In fact, it's what we did in 2013-14. Town and school buildings, we did about $10.2 million worth of improvements. The more notable ones were replacing the electric heat that was at Highland Elementary School since 1971, electric heat that was installed also at the back portion of Cheshire High School, replaced that electric heat with natural gas to provide heat, and the energy savings that we received from those projects and a whole bundling of many other projects enabled us to get, the electric heat done, did a lot of light replacements, replacement of some boilers, motors and fans and other items that consumed a lot more electricity. By bundling it into this $10.2 million project, the energy savings that we gained over 15 years basically paid for those improvements. We're in about year 9 of the current energy performance contract. So we've got 6 more years to go. And rough order of magnitude, it's about $650,000 per year is what we're paying towards those improvements. So the energy performance contract is a way to finance our capital projects. The company that we're have a proposal in front of you from is called Energia. They used to be called ECG Engineering. They served as our owner's rep in the 2013-14 project. Amoresco was the energy services company that did the work, and ECG at the time served as our owner's rep. Now we'd like to engage with the same company, it's just called Energia, to begin with a review of town and school buildings, look at everything that we have in our buildings that are using electricity, natural gas, oil, and see, is there enough savings from some of the energy improvements to help pay for some of the capital improvements we have in our capital plan. And the example that I used in the memo that I created was around Doolittle School, but this isn't just for Doolittle School. But we know at Doolittle School, we have to replace the windows, which are still mainly single pane windows. We know we have to replace the roof. And we know that we would like to add air conditioning because when the new schools are built, that would be the only elementary school that doesn't have air conditioning. So those 3 projects, rough order of magnitude, probably would total about $15 million. If we take those 3 projects, and since we're doing a new roof as an example, if we added solar on the roof system and then bundled other projects across the town where we could do energy savings, would that produce sufficient energy savings to bring the cost of those capital projects down over a 15-year period of time? The 15-year period is generally, the amount of time that you'd want to pay back your project. So, the way the contract with Energia would work, and it's a pretty simple, straightforward contract. It's 3 pages. The way they would structure it and the way it's written is They would come in and do a review at a very high level. They'd go through every building. They'd identify what projects can be done that would generate some energy savings. They already have a copy of the school's capital plan and the town's capital plan. So they'll look at which of those projects might be suitable that would work inside a new energy performance contract. Obviously, there would be a lot of discussion, from the town staff and the school staff on what our priorities would be. That review doesn't cost anything. If the town likes what they see after they receive this initial summary that would come from this review, and the town elects to go forward with the next step, which would be to identify an energy service company that would come in and do the work. At that point in time, if we'll get an investment grade audit, so it would be a much more detailed review from this energy service company. If the council at that time determines that this is a project that makes financial sense, and we do elect to go forward with an energy service contract, then Energia would be paid, but they would be paid within the contract. So there's never an outlay of funds directly, from the town until we actually engage and do an energy performance contract. If a recommendation is made from an energy service company for an energy performance contract and we just don't like the terms for whatever reason and we don't go forward, we do not owe Energia anything. So this is a way to really take a second look. I'm calling it, Energy Performance Contract 2.0. It would be a way for us to analyze what we have. Are there money savings and energy savings projects that would make sense? And if we go forward, we'll know that in probably 3 months. The rates that are provided in this agreement were already bid through the Connecticut Conference of Municipalities. So we don't have to issue an RFP in order to go into this contract that's already been bid. And we are a member of the Connecticut Conference of Municipalities. We do know that Energia is a very reputable firm. They've done a lot of work in the state of Connecticut. Since we did ours, we were one of the first, if not the first, Connecticut town and Board of Ed that did a project here in Connecticut with Energia. And the fees vary based on the size of the project. I know the council has this document, but if the total project construction cost is 10 million or greater, then the fee that Energia would be paid if we go forward with an energy service contract is 4.75%. But if the project is smaller, between 4 and 10 million, the percentage fee is higher at 6%. And if it's a project 1 to 4 million, it's 8% of the total project management cost. So I'll stop there and come up for air and see if there are any questions.
That was very good delivery. I think a very succinct representation of what's going to go on. And we do have a little experience with it, of course, too. But I'll go to my colleagues for questions. Do you have any questions? Mr. Malo.
So how does this work? Do they design these improvements or do they just advise on the scope of the improvements?
No, it's turnkey. So, if at the first stage when Energia is doing their review, they'll have some ideas of what energy savings could be gained by each of the specific projects. But in the next step, when an energy services contract is signed, the company that's selected, it could be Amoresco, Noresco, Schneider Electric. I think there's about 13 firms that are authorized in Connecticut to do this type of work. They would design, they would do the procurement, they would serve as the general construction manager to oversee the work. Energia, under this agreement, would oversee and provide, as an owner's representative, they would represent our best interests to make sure that what the energy services company is recommending and installing, does provide the energy savings we need and will, last long enough and outlast the 15 years of the financing terms. So it is turnkey. We would not
So,
get
but they're a
involved in
program
the
manager. They're
details.
not designing anything.
They
They're just
do
a
the
pro-
design and
I
the
thought you said
implementation.
I thought you said the companies that do the work are design build, and they're just a program manager.
Energia is, but then
Energia
as
is.
part of this, an energy services company would,
But that's another
work.
fee that we're going to pay.
no,
Yes, it is, because it's going to come with the construction project.
well, it's
It's going to be hidden in the
it's
construction
built
project.
into the project
It's
cost.
hidden in the
yes,
project.
Yes.
I mean, let's face it.
Yeah.
So there's a lot of fees that get paid for this. So if we take on a $5 million energy improvement project and we're paying to get it built and we're paying Energia to monitor it for us, they get paid as we get these savings. How do we pay for the project? I mean, just so I understand that we take 5 million out of pocket. Do we ever get that money back, or does,
The best way I can illustrate it,
how long does it take to get $5 million back?
if you take a look at this document, and I'll just describe
explain
it.
It's fine.
Yeah, the project cost was $10.1 million back in 2013-14. The interest rate, because we basically entered into a loan agreement, was 3.75%. We received $1.2 million in utility incentives, off that $10.2 million. So we had to finance $8.97 million. The guaranteed cost savings was $663,000 a year. So we had actually a net positive cash flow of $5,200. So we financed that over 15 years.
I was going to say, it takes 15 years to get your
Yeah.
money back.
And, if you looked at each of the components of the project, some of the projects had paybacks that were, 50 years, and some, like some of the building management system improvements, had paybacks of 4 years.
And who makes the decision as what projects we take on? The Board of Education or your office? How does it work?
Well, the way we did it last time is there were a series of recommendations that were made. There was a committee that was formed that included board, town council, energy commission. The math has to work. If the math doesn't work, then there's no contract to do. But to your point, we know that they're making money in this contract,
It's all right. Everybody
right?
needs to make money. Yeah.
But we don't have any fees to outlay. If the project, depending on what the finance looks like, the financing we pay, we get our infrastructure work done. That's the advantage of doing what we did in 2013. We did $10.2 million of work that if we would have done it, through the traditional bonding, we probably would not have done that in the 1.5 year period that we got that work done.
And these fees, you said everybody pays these same percentage fees because it's
negotiated. It's
negotiated connect.
bid already. So those are the set fees.
The only problem with projects like this, and I think is that when fees are hidden, there's a lot of fees involved. That's just the way it is. So, you got design build and how much goes to construct. I'm supportive of it because we need to do everything we can to improve our energy efficiency with our buildings. I think it's a positive thing. I think we should monitor our consultants just as much as they monitor the projects, and question how they're doing things, the decision they're making, et cetera. So we make sure that it's as efficient process as possible. So that's all.
I completely agree. The one thing that I don't think I really explained, any incentives from Eversource, we would qualify for school construction grants, which that we have a 50% reimbursement rate on qualifying projects. They would provide the assistance to obtain all those incentives. And if we go for a school construction grant, they would assist us with all of that too. So one of the advantages of doing it this way is we get expertise that we just don't have in-house. And yeah, there's a cost associated with that, but we potentially could get more projects done than we could finance on our own easily.
Ms. Nichols?
I was part of that first Amoresco project, and there was a learning curve on how it was going to work. It was so successful. We had a dynamite committee here in town that followed it through, and it really was successful. So based on that, if we follow that same model, I see no reason why this would be even questionable. I think it makes sense to me to do that. It's worked before. We know it worked in the same fashion. So, and we don't pay anything unless we decide to go forward with it. Correct?
Correct.
So, yeah, supportive of it.
Mr. Jinks, I don't want to cut any comments, but shortly, either before we vote, we'll suspend the vote on this and I'll ask for a motion to extend the meeting. So that way we can fulfill the questions and then perhaps take a vote after we vote on the other thing. So go ahead.
Thank you, Mr. Chairman. So despite your fine explanation there, Vin, I'm a little bit fuzzy on how this all works. I wasn't involved in a previous generation of this, but is the long and short of it basically that we don't do this kind of we don't have this kind of an owner's representative, the school system would be sort of flying blind as far as the best systems to install, what's going to be the most energy efficient and that kind of thing. That's kind of the long and short of it, right?
We would hire a design professional. If we were doing, for example, just the window project at Doolittle School, we would go out, we would hire an architect to, do the design work so that we would install, windows and, make sure that we get.
But it wouldn't be kind of a holistic approach as to what these guys would be doing for us.
That these guys would take a series of projects and do all those things for us without us having to do all the procurement work.
Okay. All right. Thank you.
If there's any other comments, I'll ask to suspend those for just a moment and suspend the construction, the vote, so I can get a motion to extend the meeting past 11. Second. Thank you. We have a motion and a second. All those in favor? Thank you for that. Jim, continue, or anyone else who had a question? I had one then. Windows are obviously low. They're not low. They don't pay back. So that's not even going to be part of the calculation. You're basically talking the heavy, expensive stuff. And that's, I would think, that's usually where you get the payback.
Yes. So you want to have some of your, those paybacks that are much quicker. Again,
right.
Building management, system enhancements.
Right.
That's where you get the quick payback. The thing that I'm introducing is if we add solar as an example, and we have incentives and school construction grant, which solar is eligible for, does that produce the energy savings to make this window project and everything else we bundle together feasible? It may not work. I mean,
may not.
We've talked to Energia.
Yep.
They think that we would have some substantial savings in some projects.
And if you deal with solar, which could be great, we also have to have a decent roof that it's going on. So there's a lot of parts and pieces. They don't do roofs. So there'll be a lot of examination going on here. And we'll certainly have to form a committee, as we did the last time, because it just requires some directed efforts, I think, to guide it through. But we'll take the recommendation as it is. So if there's no further discussion, we'll call for a vote on this. All those in favor? Opposed? Motion carries unanimously. Thank you. Thank you, Ben.
Thank you. Great job this evening.
You can stay.
Thank you.
Okay, we now move to the consideration of a poet laureate. Ms. Pavano.
Yes, thank you, Mr. Chair. Be it resolved that the town council approves resolution 101023-8. Be it resolved that the town council hereby creates, pursuant to the guidelines of the Connecticut Department of Economic and Community Development, the role of poet laureate for the town of Cheshire. This honorary position shall be appointed by the town council for a 2-year term with an initial term of January 1, 2024 to January 1, 2026, upon completion of a solicitation for nominations and a review of qualifications of applicant submissions by the planning committee of the town council. Be a full Cheshire resident and must remain a full Cheshire resident while serving in this role and be nominated by another Cheshire resident. Be recognized by peers and the public as an accomplished, traditionally published poet. Soon after appointment, present present to the town council a plan for the local poetry and literary activities during their 2-year term for the council's approval. Foster local public appreciation of poetry and literary arts. Implement special poetry and literary projects as identified and requested by the town council. Serve without compensation and shall not gain personal financial benefit from this role. Serve the town council with no authority to direct town officials or town staff. Turn over all original work created for the town of Cheshire as Cheshire Poets Laureate to the town for display and archival purposes.
So we had a second. I heard Mr. Jinks.
Yep, that's fine.
Thank you. Discussion. Mr. Bellower?
Just for point of clarification, should the end term be December 31st, 2025? Otherwise, they're going to lap on, otherwise the next reappointment would overlap on January 1st of 2026.
The reason why we put it this way is that so that each council in
the
the
new
2-year
council
term can select whether they want to continue this process or not. So this is.
No, I agree. I understand that, but what I'm saying is if they end on January 1st, then you can't appoint the new one on you'll have 2 poet laureates on January 1st, 2026.
Yeah, I believe you're correct. Yeah.
Oh, okay.
Right.
So it should be two.
Yeah. So I'm just wondering if their term should end December 31st of 2025.
It's New Year's Day anyway. It's New
I
Year's Eve.
I
So
understand.
That's perfect. No, that's great.
We
It's
can
good
correct
timing.
that.
Right. So that's what I'm saying. So that the new appointment would begin January 1st, 2026.
Right.
Okay.
So,
Okay.
so that seems like a pretty friendly correction.
Yeah.
I'm just
I
wondering, you know,
understand what you're saying.
Yeah. So that they're going to
So
overlap.
So planning is bringing this forward. This is something we have been discussing, and the applicants will send their applications to the planning committee, and we will look over their applications and forward it.
Any other comments?
Is it, do they have to be, send an application, or it says to be, or do they have to be suggested by another town resident?
Exactly.
Yes,
Yes.
these are very specific policies.
Yeah, nominated,
that-
yeah, because, yeah,
State of
it's not
Connecticut
submitting an
requires.
application. They have to be nominated by somebody within the
Right.
town of Cheshire, another Cheshire resident. So, and then they'll nominate them, and then you'll get them.
Right, these are very specific policies by the
Right.
state of Connecticut. Thank you.
And I don't think you could have come up with a policy so specific had you not been guided by the state statute.
That's correct.
So, I mean, I don't think we could think that hard. But go ahead, Jim.
Jim?
You're correct. We didn't think that hard. But I would say I'm excited about this process. I'm excited about us having a poet laureate, whoever that may be. And I would just like to say that this is something that's been a long time coming. So this has not been a quick, hectic or a quick decision made by the council in this case. It's been about 2 years coming.
At
So
least, yeah, at least.
it's good that we're finally here. And like I said, I think it's going to be a great thing for the town and for the seniors, for kids in school, and all the various groups that the poet laureate will be working with. I think we'll be very happy with this.
Mr. Bellwood.
Yeah, question. Do we pick the winner by like a poetry slam or something like that? Do we have like something? Is there's
Have a reading.
yeah.
I know.
Thank you.
Thank you.
Thank you. Any other questions, comments, exclamations? Okay.
Are you amending it based on the date?
Oh, yeah,
Officially,
we
you
have
probably
to.
need it.
Oh,
That's
yes.
right.
Vote to amend.
Thank you. Yeah,
Vote to amend the date. Thank you for that.
thank you.
Didn't even need the town attorney.
Check with him first.
Okay, good. Thank you.
Okay, so all those in favor of the amendment? Okay, that carried unanimously. All those in
Yes.
favor of the amended motion?
Yeah.
Could have said it that way. Okay. Motion carries unanimously.
Mr. Chairman, I believe we have a hand from the back.
Oh, so sorry.
Oh,
No.
Only if you don't want to be heard.
right away.
Right away.
Yeah.
Tonight when you get home.
Yeah,
I'll be working on it till a little bit.
we voted on it, so.
Thank
can-
you.
Yeah.
Thank you for that.
Thank you.
It's a very good question. Okay. You voted, right?
Yeah.
Thanks.
A couple times even.
Okay.
I know it's
Okay.
late, yeah.
Okay, it's not that late. I'm usually up at least another hour. Okay, so we are now moving along to the approval of a policy on naming of town-owned property. And we have Sandy for that again.
Thank you, Mr. Chair. Be it resolved that the town council approves resolution 101023-9. Be it resolved that pursuant to the recommendations of the planning committee, the town council adopts the amended policy on naming of town-owned property as presented and attached. And be it further resolved that these amendments shall be effective as of October 10, 2023, and remain in effect until modified or terminated by the town council.
Okay, we have a motion. May I have a second? Thank you, Ms. Walsh. Discussion.
Do you want me to read the whole thing? Or just-
No,
okay.
no,
All right.
but there
Good.
were highlights. No,
Good,
there were
okay.
highlights because the amendments were fairly
I
simple.
know it's late and everybody wants to get out of here.
Right.
All right, the only changes that we actually made was where they established the criteria for the naming, we omitted other than property operated by the town, the Board of Education. And the other thing was under general considerations, we took out the name shall be respected throughout the town. Those are the only two changes that we've made.
Right, because nobody gets any respect anyway.
Yeah, you know.
So, okay.
The Rodney Danger.
Thank you for that.
Yeah, you're welcome.
So I guess we're ready to vote. All those in favor? Opposed? Motion carries unanimously. Okay, we now move to the,
Good night. Thank you.
Hi, Ben.
good night, Vin.
Bye,
Thank you so
Vin.
much.
You want to go with him?
The acceptance of $500,000 for the steep grant for a splash pad and call for a public hearing for the appropriation and for the allocation of $365,000 town match. Mr. Bory?
Thank you, Mr. Chairman. I am very pleased to be able to make this motion. Be it resolved that the town council approves resolution 101023-10, and maybe I permitted to abbreviate not read every word.
I think it's fine. They get the gist of it with 500,000.
500, but this is the part that I want to read. Be it further resolved, the town council calls a public hearing November 14th to authorize a new capital project for the community pool aquatics enhancements in the amount of $865,000 with the anticipated funding of the $500,000 steep grant and an allocation from the ARPA funding in the amount of $365,000 to fulfill the town's match.
Second.
Okay.
Just briefly, that it's a wonderful thing. It's going to be used by lots of families in town with kids and all. A great enhancement, and I know we all really wanted this when we were designing the referendum question a year ago, and didn't expect to be able to do it without this help. But the ARPA funding now after tonight will be down to $1.1 million.
Right.
Unencumbered, unspent. We've got till next December, so we got 15 more months or so where we have to at least encumber it and designate it, and then we have to have it spent by the end of 26. So we're getting
Down to
there. $8.5 million, so we spent 7.4 on very good worthwhile projects for the town like this.
Thank you for that. Any other elaborations, Mr. Jenks?
I just have a quick, thank you, first of all, and I just had a quick question for Sean about the, I thought when we talked about this previously, there was some discussion of, in conjunction with this, we'd also be making some repairs to the sort of family pool area inside the building. Is that correct still?
That is correct. Yeah.
Okay.
So the project budget that totaled the $865,000 included replacement of the kiddie pool. So it's overall called, I think, generally aquatic enhancements at the community pool, but we're referring to the bulk of the project as the splash pad, but you'll have a sort of a mini splash pad, if you will, sort of fountain area to replace the sort of non-ADA accessible current kiddie pool and not functioning mushroom feature that we talked about last time. But that is all included in the cost estimate that we submitted with our grant application for the 865. And that's what necessitates, well, we got the 500,000 and then the suggested or the requested ARPA funding for the balance of the expected project cost.
Okay, I'm glad that's the case since that's what I've been telling people.
Yes, it is.
Mr.
It has the
Miller?
benefit of being true.
Good. Perfect. Sean, just a couple quick questions. So there's going to be sort of a mini splash pad inside the building, or a mini kiddie pool area with some fountain, and then the bulk of it's going to be outside.
Right. So the bulk of the splash pad area will be in the green, the grass sort of triangle between the parking lot and the pool structure itself. That's where it's envisioned and where the initial sketch designs came out. But yes, as part of this, we did want to submit as well. Once we got the cost estimates, we know the kiddie pool has been, a source of concern for all of us trying to determine its future. And again, so inside that area, I think you could picture will be sort of more paved, and then they have various, water features. Kids can step on, stand on drains, curtain drains in and around, but not maybe the full-fledged splash pad with, water buckets and all of the different things to be designed outside.
And then further within that, these areas will be accessed through the pool, right? So in theory, if you were going to use this, you'd have to be coming in through the pool. The splash pad won't be separately accessible from the pool, correct?
So almost certainly,
that
yes. But that is another piece. Now that we know we have funding commitments to do this project, that's ultimately a policy decision, how we manage access to the splash pad area. Yes, practically speaking, because we're charging for folks to come use the main pool feature, you can't really have a separate entrance to it through, I think we had envisioned in the project budget, replacing that, about 8-foot high chain link fence with something a little more aesthetically pleasing. But certainly the options to have, whether it's a wristband system or a cheap rate just to use the splash pad only, or even free, things like that are options that are on the table. We have
To be determined.
and we have time to make those decisions once we know the schedule for the project.
Thank you, because I had a couple of people ask me about that. Is that splash pad accessible, or is it only accessible?
Yeah, it's a very common question. In some communities, you'll see them just right next to playgrounds and just sort of free as the day is. We have an advantage here with the pool feature, the pool facility, given that we have lifeguards and it's desk attendants year round. So there's an opportunity actually to extend the season a little broader than you might in a community where these are just sort of turned on or turned off in a public park. We might be able to take advantage of maybe unseasonably warmer weather on either side of the summer and make it more accessible to our residents. So
thank you.
We're very excited.
Okay, any other questions, comments, or concerns? Okay, I'll call for vote. All those in favor? Opposed? Motion carries unanimously. Thank you. Our final motion up for consideration, not so much, it's the approval of a tax appeal settlement, the option of an executive session. If we think it's necessary, does anyone think it's necessary? They're satisfied, we can just do this in open session, or just have no questions that should be taken backstage? Okay. With that, Mr. Bory, could you?
Thank you, Mr. Chairman. Be resolved that the town council approves resolution 101023-11. Resolved that the town council approves the execution of a tax appeal stipulated agreement by and between the town of Cheshire and Graymar LLC for the property at 1520 Highland Avenue, and be it further resolved that the town attorney is authorized and directed to execute on behalf of the town said agreements in the form and upon the terms and conditions as presented at this meeting.
Motion, we have a second. Thank you, Mr. Walsh. Discussion? Okay.
The memo is self-explanatory.
It is.
I mean, I think it's reasonable.
Very
Yeah,
reasonable.
the property was sold in September of 2019 for $1.2 million. And, it's office space, and it was in considerable disrepair, and the office space market in Cheshire on October 1, 2018 was not good. So the net operating income was about 150,000-ish. So, our appraisal was coming in about $1.4 million. My perspective on it was that, okay, you buy the property in 2019 for $1.2 million, you put about $385,000 into it, roofing, paving, HVAC, repairs. When you buy the property, the taxes are at 2 million. So you've got a tax load that is based on what it's assessed at. So when you reduce the fair market value on 10/1/19, because that was the first year the appeal was brought, you reduce the fair market value because of the stated disrepair, that automatically makes the assessment go up because that causes the tax factor to go down, right? So the bottom line is I was able to get the plaintiff to agree to a value of $1,350,000 for 2019, $1,650,000 for 2020 to 2022, which is an average value of $1,575,000, which is higher than what our appraisal would have come in at. So that's the story.
It's a good story. Story enough, don't you agree? Okay. I'll call for a vote on this then. All those in favor? Opposed? Motion carries unanimously. Okay. This brings us to town manager's report and communications and monthly status reports.
Thank you, Mr. Chairman. I will try to be very, very brief. I know in recognizing the hour, but I do want to highlight a couple of important components. And I would encourage everyone to read through the full report. We will also be posting and sharing it online. Bulky waste is going well. We're in week 5, which is Friday collection. You'll see the hazardous waste and grass clipping disposal option collections highlighted there on the first page. And also, as we recently announced, curbside leaf collection begins on November 6th. Moving forward, very pleased to announce that our Assistant Superintendent of the Treatment Plant, Dave Milano, was named the NEWEA Connecticut Wastewater Operator of the Year. This award is given annually to an individual who has shown a high interest in performance in wastewater operations and has made significant contributions to the field. So we're incredibly proud of Dave's accomplishment there. The fall paving schedule has begun this week with millings and paving scheduled to begin next week. Cheshire has once again earned the GFOA Distinguished Budget Presentation Award. No small accomplishment. Credit to Jim and his entire staff in the finance department. They're all listed there. Encourage everyone to read through. Again, this is, I would say, even more so than the audit award that we also get annually. This takes a lot of work. We have very complicated but very informative budget documents because of this award, and we're really one of only a handful of towns that do pursue and receive this every year. It is something to be proud of. Again, there are far more that are able to get the audit award, but the distinguished budget is really an accomplishment. So kudos to Jim and the staff.
Good job.
And then just a few quick announcements. Tomorrow, October 11th, you'll see there's a Police Explorers open house. Details are listed. Encourage folks to spread the word about our wonderful Police Explorers program. Also, Monday, October 16th, there's the West Main District Design Meeting at Rebel Interactive, 7 p.m. to 8:30. Really encourage the public to come out and give their thoughts and experience the process of that design opportunity for West Main Street. A reminder on November 7th is we have our 5 referendum questions, the fire trucks, road improvement program, industrial ave culvert, Dodd Middle School boiler, and the window replacements. So encourage everyone to get out to vote. Our new location at Human Services will have a ribbon cutting and open house on Thursday, November 2nd from 3 to 5 p.m. Encourage the public to come visit the new facility. We should have the new sign put up by then, we believe the week before, which is going to look really great and really highlight the location. So please mark your calendars. I hope everybody, especially our council friends here, can attend. And also, the building department is now moving into, as of really this week, the former Human Services Department location at the bottom of the building we're in now. That is ongoing and really should be done maybe by the end of tomorrow. A reminder of the library after-hours Halloween Bash on Friday, October 27th. Various senior center events, including the 6-week Powerful Tools for Caregivers program, and also the Medicare open enrollment running from October 15th to December 7th. So now's the time. Please contact the senior center for any advice and assistance there. But I really want to highlight on the next page after that, I mentioned this in our last town manager's report, the Cheshire Park site improvements for folks that have gone by Cheshire Park and seen the incredible work. Please take a minute to read this memo later and look at some of the photos if you haven't visited. But this is really a success story, and all credit to our Public Works Department. The original bids for this project came in at almost $620,000. We had $125,000 appropriated for the drainage improvement projects. It was re-engineered and redesigned a little bit. On March 14th, 5 bids were received, and still the low bid was almost $200,000. So we were unable to do the drainage improvements with the contractor. And our Public Works team really took up the challenge and decided they would do the work in-house and be sure of, both the quality and the success of the project, and working so well with our engineering department, of course, and our Public Works Department. All credit really to the staff, including Mark Cunningham, Rich Pruitt, Kyle Hobson, Tom Underwood, Adam Quirano, Ryan Boudier, Eric Iverson, and the town engineer, Merritt Comment. Everyone, it was a really great team effort. You'll see the actual cost to self-perform ended up being $86,000. So we realized significant savings of over $100,000 by doing it in-house. And the guys, frankly, are very proud of the work they did. If you have a chance to check it out, it's great. See the photos there, some great drone shots. Solves a lot of problems.
Weather to deal with too.
They also dealt with, right. Yeah. Well, we got to test out the drainage pretty well, because
If that
it
didn't
would
work, you
flood
dealt
right
it
through.
right
But
away.
it really is, it's really a great project, and very proud of the work they did there. So I just wanted to highlight that. So thank you for the indulgence. And other than that, you'll see a project closeout report for the restroom upgrades at Quinnipiac Park.
Okay, thank you. Any questions for Sean? Okay, terrific. He had a lot of questions tonight. Okay. So now we move to reports of committees of the council. I'll start on my left if there are any.
No report.
Mr. Belliver?
No report.
Ms. Nichols?
No report.
No report. Okay, great. Okay, and then,
Actually, Mr. Chairman, can I ask a quick question of Don about the Chapman School project? Do we have any update on when that's happening?
I asked Sean the same thing, and Vin sent Bill that they're hoping to start it. They were supposed to start it in October. They're thinking now late October or early November. They're still getting everything together. Is that correct?
That's correct. Yeah, the information I had is what I forwarded to you. It's the same. It's just targeting end of March. They'll be updating this month.
Okay, all right, thanks.
I have a question, Tim, if I may.
Sure,
Just
of course.
thank you all for doing your evaluations for Sean. I'm still missing 3. I won't point out the 3, but I would like to have them, if I could, fairly soon, so that I can have them compiled and ready for our meeting next week. Okay? So those 3 of you who have not returned yours, I will expect it.
and she's on personnel. Thank you for your report. Okay. No other reports, I gather. So I don't really have a line for referrals to committee, but I would like to refer to the Ordinance Review Committee, the policy that was sort of announced, suggested this evening. And you can meet as soon as possible, hopefully, and inform the council, and we'll take it from there. If you get to work on that, and just let us know.
Great. Thank you, Mr. Chairman. We look forward to working with the council as well as the veterans on this issue to really sort of polish this up and make something that everyone can be happy with. Thank you.
Thank you for that. And I guess that fulfilled for the first time in my life miscellaneous. So now we go to liaison reports.
No report.
No report.
One thing. In the packet is a report from the Environment Commission, annual kind of summary of the activities. I think it's really well done. We won't get into it tonight, but maybe everyone could read it, and maybe we can have someone from the Environment Commission come and just talk about that. They've worked hard on it, so.
Perfect.
Thank you.
Can we get that invitation out? We'll decide. I mean, we'll get an invitation set forward. That's very good, John. Thank you.
Mr. Chairman, I apologize. Under referrals, if possible, based on a meeting I had earlier today, is it possible to refer consideration of a job description, HR generalist job description, to the Personnel Committee? I know this is unplanned, but
That's good. It's a good.
I don't want to
plan.
have to have a meeting and
One less email.
that'd be great. So if
I
you don't
think
mind.
that's an excellent.
You're adding another thing to my
If we could, unfortunately, yeah, but it
Okay,
would speed
so
up
we'll make
consideration.
that referral to personnel.
Thank you, I appreciate it.
Thank you much. Okay. We've done liaison reports. So we do have appointments to boards and commissions, I think.
That's the fair rent.
You have some people? Oh, that's fair rent. Oh, okay. So there's none of those then. You do have one.
I do have one.
Terrific.
So you're no other than fair rent?
No, there's nothing from, that's just.
In that case, Mr. Chair, I will bring forward the appointment of Courtney Cullinan to the Economic Development Commission. This is to fill the vacancy of Jamie Ferguson, term of office. We're still 10-10, so 10-10-23 through 1/31/25, and Ms. Cullinan is a Democrat.
Second that.
We have a motion. We have a second. All those in favor signify. Opposed? No opposition. Motion carries unanimously. Okay. Where are we? Town attorney and reports. Thank you, sir. Okay. Council communications. I don't have anything specific other than what we all received. Okay. We're going to bypass miscellaneous. And we do have some items for executive session. So upon a 2/3 vote, convene an executive session pursuant to CCS, little whatever that thing is, -12-6, to discuss matters concerning contract negotiations and litigation. Please, I need a motion. We move. Thank you, Ms. Nichols. A
Can we
second.
vote against it, Mr. Chair?
To include,
Who do we need? Bye, Jim.
Arnett
There'll be
can
no-
write down
there'll
who,
be no action
who, at
taken.
what time we exited and who voted to adjourn. Yeah. Yeah.
yeah. So we have, yeah, please, yeah, you got to work tomorrow.
So who's included in this?
Did we vote?
We haven't. We're just wrapping it up.
Trying to figure out who's coming to
Oh.
this meeting, I think. Noel, Chief.
So Noel is not, just Arnett, chief, and then the days.
Okay, so I'll call for a vote on the motion.
Aye. Yay, yay.
Okay. So we'll just wait for the room to be vacated.